everybody. Apologies for the slight delay to our public session of today's meeting of the Children, Adults, Health and Wellbeing Policy Development and Scrutiny panel. I'd like to welcome all to this meeting. I will very swiftly go around the room so that those who are speaking to us know who we are. And what I will, so I'll start off with myself. So my name is Dina Romero, I'm a councillor for South Down, and I also chair this panel. Liz.
Good morning, my name is Liz Hardman. I'm vice chair of this panel. I'm also councillor for Porton.
Good morning, I'm Ruth Malloy. I'm one of the Western Ward councillors, and I'm a voting member of this panel. Thank you.
Good morning, Christopher Batten, representing Teachers National Education Union, non-voting member. Thank you.
David Harding, councillor for the Chew Valley Ward, voting member.
Good morning, Onkar Seni, councillor from Coombe Down and a voting member.
Hello, Councillor Joanna Wright, Lambridge Ward, voting member.
Paul Crossley, councillor for South Down.
Good morning, Kevin Burnett, Professional Association representative for the NEHT, non-voting member.
Good morning, everyone. I'm Leslie Mansell. I'm councillor for Radstock and a voting member.
Good morning, everyone. My name is Mark Durnford. I'm the Democratic Services Officer for the panel. Thank you.
Good morning, I'm Kerry Williams and I provide the Scrutiny Officer support to the panel.
Thank you, panel. What I will do is I'll ask each of you to introduce yourselves when you speak. Okay? I've not missed anybody from the panel, I hope. And can I just ask everybody, if you are speaking, to make sure you've got your microphone on. If you stop speaking, turn your microphone off, because the camera focuses on the person whose microphone is still switched on. Okay? This meeting is being recorded. I assume everybody is quite happy with that. Good. Right, now we move on, and Mark will tell us what to do in the event of an emergency.
Great, thank you, Chair. Yes, so if the continuous alarm does sound, you must evacuate the building and proceed to the assembly point. From this room, we follow the green running person signs to the exit, using either the marble staircase or the main staircase. Please do not use the lifts. The assembly point for this building is the Orange Grove grassed area just outside Brown's Restaurant, and there's an evacuation chair for use by disabled people who so wish in the corridor outside the Council Chamber Public Gallery. Alternatively, the area at the top of the marble staircase has been designated as safe refuge, where persons needing assistance should assemble. Thank you, Chair.
Thank you very much, Mark. Apologies and any substitutions. I don't believe we have any substitutions, and I've received one apology from Dr. Barrett Pankania, and I'm not aware of anybody else who is here. Okay, thank you. Right, any declarations of interest? Kevin.
Just to say, Chair, that one family member works for Off the Record. As we come to talk about it maybe later.
Thank you for alerting us to that. I'm sure Mark will sort out any sort of registers that need to be completed. Thank you. We now move on to urgent business. There's two items I wanted to raise, and they are both connected. So, of course, you will be aware that we have been doing a piece of work on knife crime, and it's been somewhat delayed due to elections that have fallen during the time that we've been doing this piece of work. But one thing that has become quite clear is that there is a lot more that we might need to consider in terms of early help and support, and that is a piece of work that I would like to undertake to look at what provision we currently have across our authority and what more can be done. Obviously, we'll be probably looking to have some sort of working group looking at this, and we will take some, have a bit more of a discussion on that later on. I would imagine probably when we come to look at the work plan. I know that the Cabinet member also has mentioned this piece of work as well within his own report. So those were the two items that I had to report, and I have not been alerted to any other urgent business. So we now move on to our public statements. I know that Councillor Jackson will be arriving at some point. She's been delayed, and she will be speaking about SACRE. But in the meantime, I will ask Richard Franklin, who I believe is sitting here, to speak to us about Newton House. Okay, over to you.
Just first of all, thank you everybody for giving me the time to make this statement. Without the short breaks, respite at Newton House, my son and many others will have to go into full-time residential care at a much higher cost. Is that important? I guess the first thing when you're handing over your son is trust, and after all the troubles with other homes in the past and knowing how vulnerable these service users can be, it's on another level. Trust has been built that we now hardly hear from the team when they have Ryan after a bedding in period of months. The staff now know his needs, are trained to do so and deal with him safely. We can always find a workabout if there is a problem or an issue, and we're left to enjoy the free time, something of a bit of a normal life. We know Ryan enjoys his time there, and away from us, having a break is no different to all our kids going away from their parents and enjoying that free time. David and his team make sure that everything runs smoothly and Ryan is not mixed with some of the other users because of his size, lack of mobility, so he does not get hurt at any time. So this home is a total lifeline that gives us just a little bit of time to enjoy that bit of freedom without any stress and any fuss and any worry. The situation has done nothing but cause stress, anxiety and worry to the both of us, me and my wife and other users, when we feel there's no need to without other providers in place, that we've got to go through the whole issue of trust. In the email received from Alison Bourne, she says her team will review each case. This once again costs money when Ryan has just been reviewed just 2 weeks ago because of a mess up on the behalf of Baines. And this always means and comes at a cost to try and provide less care in most cases. We live day by day, stress, anxiety, dealing with Ryan. Never a day goes by without something wrong or not right at the chemist, at the transport, just in general. The biggest worry of them all, though, is loss, his lifeline. At the age of 60, at the age Julie is 60 and I'm 56, with a few medical issues, we need all the help we can get. Myself, I've had a broken back and neck, but I continue to do my best in looking after Ryan. With the average population going up in the UK, we should be providing more care, not cutting it down to none. Just a few pennies worth from my side, and I suspect that it's the same for a lot of other users. I'd like to thank you all for the support. It really is at home this weekend how important this respite and care is, and the thanks for giving me the chance to speak. The service users only want care, safety, love and compassion in the respite home. Thanks.
Thank you very much, Mr. Franklin, for sharing your thoughts with us. I don't know if we've got any comments. Liz.
Firstly, Mr Franklin, thank you very much for coming along, and thank you for making us aware of what was actually happening to your son, Ryan. And it was your story that alerted us as to what was happening, because very few of us knew that Newton House was actually proposed to be closed as a respite centre. Firstly, I have two questions, if this is okay to put to you. How much notice were you actually given that this respite care home was actually going to be closed?
We received a letter in the post 2 weeks ago.
So, saying that it was going to close within the next couple of weeks, couple of months, was it?
To close on, well, no more bookings taken after February the 1st.
So very little notice and such bad timing just before Christmas. The second question I would like to ask you is that we're told that there will be alternative provision for this respite care home. Now, we understand that there aren't any other respite care homes, so we wonder what alternative provision have you actually been offered. We've also been told that the needs of the users will be reviewed. So, firstly, have you been offered any alternative provision? Secondly, have the needs of Ryan been reviewed and plans drawn up for him?
No, we've been offered no other provisions, and Ryan was reviewed 2 weeks ago. That was due to a mess up to his care plan package. So, yeah, that's the last, but that wasn't part of this process.
Thank you very much, Mr Franklin.
Thank you, Liz, for your questions as well. I believe that this decision has been paused now. Were you aware of that pause? And during this period of time, I understand that that there will be a reassessment of all residents' needs as well. So have you been made aware of that?
Yes, we have been made aware that it's been paused, but I've had a few concerned parents who don't know whether that means pause is stopping care or no bookings at all are taken after February the 1st, because people are planning holidays, whether there's going to be any provision at all from February the 1st, whether they can still book in dates.
Okay. I've invited the Cabinet Member, Alison Bourne, to speak to us about this issue in January. So I'm very happy if you'd like to attend that meeting as well, and to hear firsthand of what the plans are. And perhaps by that stage there will be more information available to the users of Newton House as well. So please, it would be great if you were able to attend. I'm going to leave this here for now. But as I said, the Cabinet Member for this area will be with us in January to talk about this in detail. But if you've got specific questions that you want to raise with her, I suggest that we send them via Mark to her about this. So thank you very much, Mr Franklin, for taking the time to come and share with us your concerns and your story. Thank you. You're more than welcome to stay for the rest of the meeting if you wish to. So I'm now going to move on to the minutes of the last meeting, which was in November. And so I'm just going to ask people to tell me if there's any corrections to these minutes. And if not, is there anything that is not picked up either in the work plan for this meeting or in the agenda for this meeting or the future work plan that they think needs to be raised? Liz.
did ask Alison Bourne to remind us of the warm spaces that have been set aside in Baines for people who have a need of going somewhere warm during cold winter periods. I think I've received something from Mark about... No, I haven't actually. I haven't received anything from you about this. Sorry, Mark. So, yes, indeed. So perhaps that could be asked of Alison. Could she let us know about these warm places? In fact, maybe you could go out on one of the email letters from Kevin Guy to remind people about warm places.
Absolutely. So we'll pick that up and make sure, because if we wait till January, you know, there's obviously going to be a need between now and January for warm places, isn't there? And I know there are a number of places that are already offering their space. Okay, any other comments? Ruth and then Liz.
I was just going to say about the warm spaces, there is a directory on the website, isn't there? But I agree, it'd be good to advertise there.
Thank you, and actually to make sure that it's easy to navigate to find that space on the website as well. Leslie.
Yes, thank you. On page 7, we were looking at social prescribing, and Kate Morton said they've been doing a study which is almost finished, and they're going to present it at the Health and Wellbeing Board in February. So can this also be reported here? And then on page 12, on the warm places, with a household support grant, I think we call it something different here. What are we doing to make sure that people are able to access that household support grant, especially considering the winter fuel allowance has been removed? And then on page 12, this is back to the equality impact assessment with regard to the HCRG. So we've just heard prior to this that there is one, that it is going to be reviewed, but I'd ask when we can see that equality impact assessment, because our responsibility is to make sure that we're meeting that PSED, and if we're not, then we could be in court paying a lot of fines, and we'd be responsible, not HCRG, we would. Thank you.
Thank you very much, Leslie. So those points are duly noted. I think the fund you're talking about is the Household Support Fund. And it is where funding for everything from our school meal vouchers during holiday time also comes from. Right, any other comments on the meeting minutes? In that case, can I take that as being a correct version of the meeting, with, of course, those various points to be followed up as well? Okay, good. Anybody who wishes to disagree? Fantastic. Okay, now we move on to the next item on our agenda, which is the Cabinet Member Update, which you will have seen in your pack. I don't know if Councillor May would like to, first of all, introduce himself, because I didn't let you do that before, and also to see if there's anything else you'd like to add before we move into our question session.
Thank you, Chair. I'm Paul May. I'm a councillor. I represent Pensford and Whitchurch Village, and I'm the Cabinet Member for Children and Young People. In terms of the report, I'm welcome to take any queries along the way. Just a couple of things I'd like to highlight, if I can. The first is, you mentioned just now about the policy development role. I would like to think that we could work on that early help idea that you mentioned, Chair, but learning from the knife crime review, it is important that we have a clear set of terms of reference for a working group, and that we actually make sure that you get the support to do that work. It's quite clear with the new government, a lot of things are changing in terms of early help, and I think from our point of view, it would be really good within the constraints of existing budgets, but to actually look to see how we could be more effective in the future in terms of early help. Because I think everybody in this room would agree, the more you can do in terms of early intervention and early help means that further down the line the problems are less. So it is something that I would be supporting the committee if the committee actually feels that they could actually set up a working group, and I would hope that you perhaps could take that on board. The second thing is we've had two Ofsted and HMIP inspections, and I think I would really like the committee to, I've already sent my thanks to Mary and her staff, but it was very clear on both the feedbacks that we've had was that how well it was organised and how open and transparent the staff have been in terms of those two inspections. And I think it would be really nice if the committee could, in actual fact, just say a big thank you back to the staff for all their efforts that they put in. Otherwise, I can take any queries on the report, Chair, rather than talk too much, which is my normal habit.
Thank you very much, Paul. And of course, we echo your last comments, particularly around the thank you and the well done to all the staff that were involved. And absolutely, I pick up on the point that you made around the benefits of having a proper sort of early help and support structure in place. As you say, it can maybe it can mean that sometimes that some of those issues that are more challenging in later life actually don't come through in quite such strength, but also, in terms of, more prosaic matter, that it can also save the council and other partners significant sums in the future in terms of spending. So do we have any other questions or points people want to make to the Cabinet Member? Liz and then Paul.
Thank you. Paul, I'm a bit confused as to what's the difference between, or the difference in emphasis between the working party that I'm on with Dina and other councillors looking at knife crime and looking at what can be done to reduce knife crime, and then this new working party that you're setting up. So that's my first question. Oh, sorry, excuse me. Dina's setting up.
Chair, I hope it's we are setting up, because quite clearly it is something that the committee's got to feel confident about. At an operational level, we would be doing whatever comes through from the government in the correct or best way and would be advising the committee. It's just a slightly different approach that is a policy development and scrutiny committee, and it's whether the committee would like to be involved with policy development. But this is where I was taking the Chair's comments, we've got to be very careful that if we do set up a working group that you get the proper support to be able to do that. Because if you haven't got it, then you're just going to be giving up your time and it will be very frustrating. So I think we've probably learned a little bit from the knife crime exercise and listened to what the Chair said about she didn't have enough really support to be able to do that as effectively as she would have liked.
One last question, please, on free school meals. And it's wonderful that we've got this auto-registration of parents, carers who are entitled to free school meals. But I did wonder, will we inform schools about this? I'm a school governor, and I was making it clear to my governing body that this is what's going to happen. I know we had Damien Peake, he was at our Fair Food Alliance meeting, and he's obviously got fantastic grip on what's happening and how it's going to happen. But I wondered about letting schools know, because that's one of the things about auto-registration, that it takes some of the onus off schools to actually get parents to apply for this.
Sorry, I didn't turn my speaker off, Chair. Yes, we've got the new Send AP advice service that is mentioned in Laura's report later, and we can use that to actually inform the schools, because it is important that we actually see this as the total needs of young people. Some of them relate to schools, some of it social care, so it's a whole range of things, and we make sure that we talk, including with our colleagues in health.
Thank you.
Chris, you press it once.
Thank you. I've got the tech. And Paul's right. There's many ways and means we can talk to schools about it, but just to reassure, I've already let our chief exec officers and heads of academy schools know this is something we're doing, and it's a really positive thing. We're planning a formal newsletter comms piece this week about what it is, what it means, and with the project plan for the delivery of it as well. But it's a really good point about governors to make sure we let them know as well. Thanks, please.
Sorry, Chris, would you mind also, I'm sure everybody does know who you are, but could you just say who you are?
Chris Wilford, Director of Education and Safeguarding for Bates.
Thank you. Okay, so my next person with a comment or question is Paul Crossley.
Thank you very much, Chair. I've got two questions, two different areas, one on a report and one on a gap in the report. It's not a gap because you've never been notified. I'm just asking, it's follow on from knife crime. So the first one on music, I'm really pleased to see the success of the charitable rollout of this service from 3 councils to an independent charity sector. So my first question is, on the report, you give us some good news about the Midsummer Norton area and good news about the Bath area. In your next report, can you also include what's happening in the Keynsham and the Chew Valley area, or can you give us that at this meeting? And secondly, does the charity have goals and aspirations for its future delivery, i.e. is there a project for increasing music in schools on an annual basis, and if so, what are the consequences of that project and how is it going to be funded? So that's my first set of questions.
Yeah, it is. I think it's really good news that they got the charity off the ground between the three local areas. I think it gives them, in the context of the changes to Arts Council England, the direction, way forward, having bigger footprints and regions for music. I think it's a good. I think it's a good thing what they've done, and it's pleasing to see that they're building on their success. A lot of their funding is driven through the events that they do, but also through raising money through the work that they deliver, either in group or individual sessions, but also through the Arts Council grants they receive. I certainly can ask them to provide more information about the Keynsham area. That's no problem. Simon Mock, who is the director, did actually, I've just picked his email up, he said he'd be more than pleased to come and talk about it to Scrutiny a bit further. He's really keen to engage with people and make sure people understand what the offer is in their different wards. Sorry to do that.
You said you had another question, Paul.
Yeah, sorry. And my second question is a consequence of the knife crime work. With this, there's undoubtedly going to be young males and females put into institutions for various periods of times. What work do we do with our young people who are put into institutions at Her Majesty's leisure? His Majesty, sorry. I forgot which chair, whatever they call it now. What work are we going to be planning to do with these young people so that when they come out, they have other options in life other than just negative ones?
Chair, I'll try and answer that, and if you want more detail, I'll refer to Mary. We recently, and I reported it, had the inspection of the Youth Justice Service, and that is very much more now focusing on young children as the priority, and to actually make sure that we, and I've met the team, they actually work with the young person that's gone to court, and after court is quite clearly one of the issues we have to have clear responsibility to stay with those youngsters, and they actually really care about them, and under those circumstances they do the best they can afterwards, and they stay with those young people after they've been to court. And I think it's we'll see, and I've mentioned to the report coming in, Chair, I'll make sure that this committee gets a copy of that report when it comes in. I think it's going to be February, and when that is the case, there'll be an action plan, and if that's one of the issues that we need to follow up more on, then we will. But I've met the team, and they're really, really dedicated in what they do. So I'm hoping fingers crossed, Chair, that we'll get a positive report from the HMIP, which is the Her Majesty's Inspectorate of Probation, which is quite an odd group to be inspecting us, but it's part of a whole national series of inspections that have taken place. And I'm very, very much welcome to the opportunity of giving the committee that full report at the appropriate stage. Mary?
Thank you. So a couple of other additional, if I may, Mary Kerry Knowles, Director of Children's Services. So we have a range of services in Baines. One is called our Compass service, which is our preventative service, which aims to work with children 10 and above who are at risk of committing offence. So what we want is for any organisation, for our schools, our families, to refer children through where there might be some concerns. We do have a multi-agency youth justice service that Councillor May has referenced. We've had the inspection that really does excellent multi-agency work in terms of supporting children all the way through from at risk of offending and then coming out the other side, even if they've been in custody. So every child who's in custody has an allocated case officer, but they would also generally have the support of children's social care. We have received additional funding for the last 2 years through the Office of Police and Crime Commissioner to do some enhanced interventions for young people, and that's known as the Violence Reduction Partnership. And we've also had some additional funding from the Department for Education around turnaround. Again, that's another preventative service aimed at supporting and delivering interventions for young people. We've previously updated the panel in terms of the violence reduction partnership events and the sessions for parents and professionals, and those will continue to be rolled out throughout the remainder of this year. And the evidence is that mentoring by a lived experience has been really, really helpful. There's been a lot of sessions directly into our schools and settings and providing direct support, and we've developed a resource for parents as well. So there's a lot happening, but there's still a lot more to do, because obviously for any young person who ends up incarcerated, we do want that young person to continue in education and to be able to come back out and thrive back in the community.
It's quick, Paul.
Just a question on numbers. So how many young people are we talking about in Baines? And of those, how many of those young people are from our own looked after children?
So, thankfully, our numbers in Baines continue to be very small, and we had a number of years where we had no children incarcerated at all. We've had 2 in the last year, one of which was a care experienced young person.
Thank you, and actually it has reminded me, I think last year that we received the Youth Justice Plan slightly out of sync, so can we make sure that this time we actually receive it before it goes through to Cabinet and through to the councils? I think we actually saw it at the wrong part in that process.
Chair, if I may, last year's Youth Justice Plan was a 2-year plan. Would it be helpful then if we presented an update in terms of the implementation?
Absolutely, yes, I think that would be really helpful. Thank you. So next on my list I've got Kevin and then Leslie.
Thank you, Chair. Three points, please, Paul, but just very quickly on the free school meals. Can you just clarify how parents are involved in this auto-enrolment process and how they are being informed and advised of the good things that it is? And when the auto-enrolment actually happens, presumably the money goes straight into school budgets. The schools wouldn't have to do anything else as far as admin. Could you just clarify that bit, please? Then the other 3 bits are around the music service, is really around, has it got long-term funding now, and how precarious or not is it? Is there a buy-in from all the MATs in Baines, and is that something that's important to its success? Then around the second bit is around hers, and would we be able to see the categories that the children are being supported under? rather than just numbers, so that if we can see the areas where there are, for example, social and emotional support, and if that is outweighing or the main part of their focus. And finally, children's services, contracts and finances. I may be a little confused on this, so forgive me, but when we had discussion about community contracts, there seemed to be community contracts for adult social care and community contracts for children's services, and just wondered, has these been reviewed? Where are these at? Because I know that in the last meeting, which I wasn't able to come to, there was some discussion around timelines and revised things for the adult social care. Where are we with the children's services, please? Thank you.
I think on the music service, just what I'd like to add on that is I remember that in the days of Avon County, or the County of Avon, I think the music service was one of the best in the country, and I think the fact that they've now all pulled together is really important. In terms of the long-term funding, I'll refer that to Chris because that's a level of detail I don't have. But would you like to take that? Then I'll take your other questions in afterwards. And can you pick up the HERS question as well? Because I noticed in my report I said, Chris, can you please give more detail about that? Because I didn't know. I met them up there at Alfred School. But it's something that was, I didn't know exactly what they were doing, and I've asked Chris for a briefing myself, so it'd be really good if he could pick up that point as well, please.
No problem. On the music service, I'm rewinding my brain to a couple of years ago when we were doing this piece of work to do it, but I'm pretty sure the Arts Council funding, which was awarded in the April of last year, was for 3 years, but I will need to double check that. And yes, they will also be, they're a not-for-profit charity. The WEMA is a trading arm of the charity, it's a not-for-profit one, but they will be reliant on raising income through tuitions and working very closely with the MATs and trusts. And I did my best to promote them and point them in the right direction. There are, of course, other music services out there and people who work privately, which are also able to compete for work with, or tender for work with the schools. But they very much need to work very closely in partnership with the local area and with the local schools and trusts, which is why I believe Simon's really keen to come here and talk to yourselves about further work that they're doing in the local area. Free school meals, I'm going to profess not to know the exact detail of what it is. I'm looking at a complicated project plan here about when all the information is going to go out, when parents will be communicated to and how parents will be communicated with. The welfare team are following a toolkit, which is the Fix My Food toolkit, which includes lots of information about what you need to tell parents and how you tell them. But importantly, that parents do still have the right to opt out of that enrolment, so there's information about that as well. But I can't profess to know exactly when that's going to happen. I can see in my plan that we'll be starting to do that in January and February of next year with the welfare advice team. And yes, like any funds which are given to schools for pupil premium funding for childhood and registered free school meals, that money would go normally direct to the schools. Hospital education service, we certainly can let you have the information about the categories for children. I can probably say quite certainly that the majority of children being supported at the moment is due to emotional mental health reasons, but I will ask Goldwyn to put a bit on the information we've got about reasons why they were referred.
There might be an opportunity to speak more about that when we come to the HCP item as well. So on my list I have...
Oh, sorry, Chair, we haven't answered the last question, which was around the finances. The reason I put that item on my report was it went to the Cabinet about the fact that the Council were overspending to the tune of £5.5 million this year, which was really very sensitive for the Council. But I think it was important for me that I actually record that we are not dropping any of the standards for the young children that we support. And even though those discussions are really uncomfortable, they do reflect the fact that the need for our services, our children's services, is so high. And the council has to work out how they can do that. And the Cabinet actually were addressing that quite clearly at their meeting. But I thought for the committee it's important that we say that we maintain those services, because the committee really does need to have that assurance we're not cutting services as a result of that overspend.
Sorry, Chair, may I just ask Paul, so in terms of that big discussion around contracts and everything where we were, everything's on hold at the moment, no decisions have been made?
I don't really understand the question, Kevin. I think you're talking about the community issues, which was put in the budget last year, that there would be £150,000 savings. Those are something which is a cut, if you want to call it that way. It's a saving is the technical term, but it is a reduction. And we're working very closely with the health team, because that's where the responsibility is for that. That's not the ICB, that's our health, Rebecca's team, to actually mitigate the effect of that. But that affects both inside and outside suppliers. So it does affect possibly a range of suppliers that we have in terms of children's services, which might be Mentoring Plus, Southside, Bath Area Play. I can't think of, there's another one I missed. Anyway, so it does affect a number of our suppliers, but we're working with them to make sure that we mitigate the effects of that. Because the great risk is if you cut that, which is why the early help is so important, and why I totally support this. It was something that was asked for us to do at the budget stage last year, and I still feel really that quite strongly that this is something that we've got to be very careful that we don't cut early help and then you find more children coming into care later on. So it is something that is an argument that, or a discussion that is continuing at this moment.
Right, so, sorry, yeah. So the discussion
it's not on hold.
is...
We're still doing what we were set out to do. The only issue was the Cabinet member for Resources said that if there was going to be an additional long-term cost, then that would not, bless you, that would not be a sensible cut to make. So what we're doing is we're working that through in a correct and technical way. And we'll bring that back to committee when we're ready to actually implement it.
On that point, can I just also ask that when we are presented with the budget papers, that if there are these ongoing discussions about other sums of money, that they're included somehow within, for example, within the notes, so that we can take that into account when we're looking at the figures that we'll be presented with.
I think we've got an internal working party, which is an officer working party, but Councillor Bourne and myself are actually involved in that working party because our concern that we've expressed, I think, quite openly to the voluntary sector, the community sector, but we actually wanted to be involved in that process. It's still going on, and there are discussions taking place. And if you remember the meeting before last, or the one before that, the voluntary sector came along and were actually quite concerned that we weren't talking effectively with them. And since then, we've had several meetings, which Alison Bourne and myself have been present at. And we had one even last week with 3SG talking about it. It's a difficult thing because there's other contracts which are going out, including a health contract, and under those circumstances, we care about the voluntary sector, and we're trying to make sure that whatever happens, we're doing our best to protect that sector because it is so important to us, I think, as an organisation and for others involved. But it's a difficult time. I mean, other authorities have cut these services in the past, and that's not where we want to be. We very much value what they do. I'm sorry, it's not a black and white answer, I'm afraid, Chair.
No, I mean, my point was that when we look at the budget papers in the next, it's either the next meeting or the one after that, that we have just some reminder of what has happened for this past year, so we can consider that in a more, what's what I'm thinking of, sort of holistic way. Thank you.
If you remember, it was a medium-term financial plan that was approved last year, so it is something that we will be picking those things up, I think the committee quite rightly should be challenging and asking us probing questions, which, you know, we welcome that, I think.
Thank you. I'll remind you that you welcome them. Leslie.
Yes, thank you for the report, Paul. I've got various questions I wanted to pick up. So the first one around the knife crime and the suggestion to have a subgroup committee, whatever, to have a look at this. So how does this link in with the knife crime reduction partnership? That's the first question. And the second question from me is, which leads on to the Youth Justice Service. What is being done to try and ensure we've got strategies in place to stop young people going through that Youth Justice Service? It's far more expensive to have people in prison than it is to have them in schools. The music service, something I certainly welcome. It's in the forward plan. When can we see a report on this? Can we see the data? And also, it would be good to have some information about how this benefits children. I mean, the research shows that it does, but it'd be good to have that set out. And then on the home education and hers, I've got various questions, because I'm a bit concerned that here again we've seen another child, Sarah Sharif, murdered at home by her parents, or parents and step-parents. It wasn't 5 minutes ago, well, 2021, since we saw Victoria Climbier and a whole report that looked at that, which talked then about better reporting arrangements and what could be done to prevent another death happening. Following the Sarah Sharif outcome in court, it was said that nearly 500 children across the country have actually died over the last year, which I think is pretty shocking, to say the least. And I can go back as far as 1965, when Maria Colwell was murdered by her stepfather. And every time we hear this, you know, it's not going to happen again, it's not going to happen again, and it does. So I've actually got a series of questions around, you know, what is Baines doing to make sure that we're meeting the legal requirements? How many safeguarding visits do pupils receive per year who are being educated at home? What are the absenteeism rates for her students? What's the local authority doing to work with national government to create a modern education system for children who nationally and locally are voting with their feet? What percentage of hers children are with the service due to mental health issues? And what's the reporting on this? Not all children out of school are EHE or hers. So how many children are having their education at school through organisations such as Jigsaw or other SEND provisions? And how many schools employ private home educators? And are those figures reported to the LA? Thank you.
So not much to answer there.
Councillor Mansell, can I just suggest that those are a really good set of questions, so I'm not ducking the questions. It'd be really handy if you perhaps could send me an email with those questions, and I'll make sure you get specific answers, because I think in the committee it's really difficult to answer those questions, even with the experts present. I'll go through your queries from the top, though, if I can. On the knife crime, how does it fit in with the knife crime reduction partnership? I don't know quite what to say. Mary, could you just pick up that?
I'm happy to answer that. So colleagues who work across children's services have been involved in the knife crime planning in terms of the work that Councillor Romero is leading on. So that's the direct input in terms of officer input. In terms of the next question around strategies to keep children out of custody, so all of the work that we do across children's services, be that with our safeguarding teams, our adolescent care experience team, all of those teams work in partnership with our schools, families, and where we possibly can to avoid children committing any offences and or coming into care or into custody. I mentioned earlier the couple of different programmes that we've got. We've got a range of very good programmes in Bath and Somerset. We've got a preventative service that is Compass. We've also got the turnaround project, and then we've got the work of the youth offending teams who work very closely with children's social care and education colleagues to keep children in school as best we can and to try and avoid them getting into trouble and or requiring custody. Custody is the last place we would want for any young person. We would want to support them effectively at home in the community. Councillor May has referenced the Youth Justice Inspection Report, and while that report won't be public to February, it does recognise the quality of good multi-agency working supporting vulnerable children across Bath and North East Somerset. Thank you.
Can I just add a couple of things, Leslie, if I can? I think the knife crime work was complementary, really, to the work that's done by the knife crime reduction partnership. We had a series of 3 major knife crime incidents which generated a lot of concern in the community, which the partnership has been working on that to actually reduce that level of concern. But I think the work that this committee was going to do was to look at the wider picture rather than individual cases and that direct impact. So it was to look at what opportunities there could be in terms of policy development. So as I see it, it's something that I assumed was going to be complementary to the work of the reduction partnership. On the youth justice side, I think the key issue there was, in my view, was the inspection done by the HMIP, which will then actually pick up anything that is, I was going to say, if there is anything faulty in what we're doing. They were very, very thorough in the work they did. And I think we'll see whether there's anything there. If there is anything, then we will pick that up and we'll provide an action plan back to this committee so that you can see that we are dealing with it correctly. I think the important thing really is that it is seen, and I was very impressed because we do work in partnership on the youth justice side, and that partnership, when we're scrutinised by the inspectors, was really effective. And colleagues that we work with, sort of side by side, whether it was police, health, mental health, everybody, probation, everybody really responded really well. And I actually walked away from that meeting with the inspectorate feeling, well, these are our colleagues and they actually do all care about young people. On the home education, yes, I think I've been talking to Mary, and I think it's important that we actually don't just say, oh, well, that was somewhere else. So we have done a complete review, which we've got to be very careful in terms of any detail we give to the committee. But I can only just assure you that we've looked at our own arrangements to make sure there's no child at risk within Bath and North East Somerset, and I think you would expect us to do that, and it has been done, and I'm checking with Mary on a regular basis to make sure that that is done effectively. On the music service, I think what we can do, perhaps pick up later in terms of your programme, Chair, we can pick up when we can bring that back, and between now and that item on the agenda, I'm sure Chris will have an answer for you. Thank you, Chair.
Thank you. Thank you very much for such a thorough response. I think some of the, well, most of the items that Leslie has mentioned, I think will be of great concern to all of us, particularly around this, the recent findings of the tragic, the tragedy. Okay, so I'm going back to my list. I've got Ruth, and then Joanna, and then David.
Thank you. Thanks for your report, Paul. Just a few comments and a question, really. Again, about the this new task and finish group that you were suggesting to set up. I'm sure something useful will come out of it, but I'm a bit concerned that resources go into that when maybe they could be directed somewhere else, and the Violence Reduction Partnership is already doing such a comprehensive good job, I think. But just to say, when it comes down to resources, I'm not sure. Perhaps I haven't got the right understanding of what will be involved, but wouldn't like to duplicate work, is basically what I'm saying. Next point was, about home education. We asked previously to have information about that, and so thank you for including something, but it's not very much information. And seeing there it says advisory teachers visit our elected home educated families annually, so once a year doesn't sound like very frequently to me. So I would really welcome a much fuller report actually on home education to the panel as a whole, please. And then the other thing was sort of comment, really. Also, I would welcome more information on the HERS, which is what the Hospital Education Reintegration Service. I find it very interesting that the figures that we've been presented here, that approximately, or more than in each category, there are about double as many girls as boys. And you're saying it's a lot of the cases that it's because of mental health issues. So I think that's quite revealing. So it'd be good to understand a bit more behind the figures there. And also a question, because I'm not quite sure myself. I know that we have an alternative provision when it comes to education. And so I'd like to sort of understand if that's a kind of broader term then, and how the HERS service sort of fits in with that. Would you perhaps start off, if it was needed, using that service and then progress on to alternative provision or mainstream schools? I'd just quite like to understand a bit more how that all fits together, please. Thank you.
Can I pick up just the first point? So Ruth, you did mention about duplication of work, and I know that it came up in Leslie's questions too. Can I just assure everybody in this panel that we've been quite conscious in the task group to not duplicate the work that the Violence Reduction Partnership is doing? We asked for to know what they were doing, so that we could look at how that fitted into, a more overarching strategy. And I think it has become a bit confused, because what I think Councillor May was referring to was learnings from this piece of work around how we could be better informed in then starting a new piece of work, which is about looking at early help and support with a view to understanding what there is out there, what it does. I'm trying not to put words into the sort of the collective mouths of the panel, but what happens if it stops? All of this kind of piece of work, and as has been stated previously, to ensure that it is we have a proper understanding as a panel about that, what that can do, in order that we can ensure that there is less expensive resource needed in the future. And actually, I welcomed Councillor May's statement several times about ensuring that there would be support for this ongoing piece of work, which again, we know won't be a very quick piece of work, because we've got to build in what is happening from government level as well. So my apologies, I know this is your report, but I just wanted to try and clarify that piece first.
Thank you, Chair. It's nice to be able to agree with you. Thank you. I mean, can I just make the point that with the new government, there's a lot of new thoughts coming through. And councillors come at things from a different direction to the professionals. And I think it's really sensible, if we get the proper terms of reference, which we've already done some work on that we're going to be doing this work around early help as the information comes out from government. But we're going to be doing that, I would like to think we're doing that in partnership with the committee, as opposed to us coming back at a later stage and saying it's A, B and C. And I don't think that's duplication in any shape or form. I discussed it with Mary, whether she felt happy having this policy development role, and also with Mandy Bishop, who's the Director of Operations, so that it's something where I see it as, if you like, co-reduction. I'm just one councillor and I represent the best I can working with the officers, but it just struck me that it's something which a committee can be much more effective about in adding value to the work that's being done. On the knife crime side, I'm still waiting to hear, what you come back with. But we've learned, I think, the lesson that it's great to just say, let's have a working party, but a working party needs administration and help and needs the officers on board. So I thought that if we're going to do this, let's actually do it in an effective way moving forward. And I would hope the committee can feel able to agree that work and people will volunteer to do it. On the home education side, not much information. I'll look at my colleagues whether we can provide more on home education numbers.
I mean, I think it's a really interesting topic at the moment, isn't it, with the news that we've had recently. For this paper, we're asked purely just to provide the numbers, which we did. And you will see from those numbers that they have increased, but I think it'd be a good information topic to look at as part of programme settings for the agenda, and we could perhaps pull in alternative provision in there as well and combine that into one bit of information, because I think that's a really interesting thing to look at as well at this time. You will see nationally that there are more children outside of mainstream education across the country, and I believe that's one of the new Labour government's plans, is to look at how it tackles that here in Baines. So I think that'll be a good subtopic for that. Just to provide reassurance that the annual visit is based, how we visit our elective home education parents is based on a RAG rating system. So there are many parents in Baines who very competently electively home educate and feel that that's their right. And then there are parents who we would say have concerns about, and then depending on how we RAG rate that, we would depend on the level of visiting we do. We also employ a school nurse who works with us to make sure that we can look at any health needs that there might be around those families. But all of this is done on a level of trust, and with the parents that are allowing us to do this. We're not able to impose our visits into the at the moment, and that's the piece of legislation which the government is looking at, particularly for vulnerable children. It has been looked at many times over the years. It hasn't yet ever made it through a parliament to change or amend that act, but the Labour government does seem to want to proceed with that matter. But absolutely can provide more information. Alternative provision for HERS. So the role of HERS is to return children to their mainstream education, so that's what we're wanting to do. The council, the local authority has in the Education Act statutory duty to provide alternative provision under a number of occasions, but one is for if you're excluded from school or at risk of being excluded from school, but the other one is providing provision for children who have got medical needs, and that's the alternative. It is actually HERS is actually what we call alternative provision.
Just thinking about the, you were saying about the visits to families, it depends on various things, but does it also in any way depend on the age of the children in question? Because I was thinking if you're like, 5 or 6, a whole year is a very large, amount of time compared with if you're 18, for example. I know that children develop at different stages and there are different things to look out for, but I was thinking, that's why I think once a year, even if you think everything's going well, there's still a long period, you know, and every 6 months would be, I would think, better. But anyway, that's my thoughts.
I mean, what I would say is many families are actively engaging with us beyond that as well. So they'll come to us because we also help families network and we provide additional information about EHE. So we don't necessarily do it through encouraging it, but we do help people find resources. So that once a year would be the minimum in terms of a statutory visit. There are lots of other information and contact we will have with our families. The people who visit are all teachers, and we employ teachers. The service itself sits under the virtual school. So it works alongside our virtual school colleagues and alongside the attendance and welfare service. And we obviously work very closely alongside our social care colleagues who we're aware of as well.
Thank you, Ruth. So next on my list is Joanna and then David.
Hello, thank you. Thank you for your report. I'm just following up from Councillor Mansell and Councillor Malloy on their conversations about homeschool children and safeguarding, which is clearly seems to be an important issue following on the awful event of her, Sarah Sheriff being killed by her family. I guess the wider point too is also about policy development and scrutiny, which is what this chamber is about. And essentially, I guess we're not trying to challenge you in what you do, but what we are concerned about is that there isn't enough policy to protect children. And I guess our role is to make sure that that policy gets created, whether even at a local level or challenging government to put it in a national level. So I guess my question is, do we need to come up with something that we think should be policy at a local level and then say to national government, you need to be delivering this? And what does that look like? And clearly your expertise of years of dealing with children and families, we need that information from you so that we can then say this is what the policy should look like. So again, that partnership in this room maybe is what we're looking for through these questions. Does that seem reasonable? And Councillor May, I appreciate your paper. However, there does seem to be a bit missing, and could we maybe in 2 months' time have something on this to work out how policy could be developed from this?
Once again, as I said to Councillor Mansell, you know, I think they're good questions, and I think when I do a cabinet report, it tends to be, if you like, strategic, and the committee is interested in the detail, and therefore I've got really good people sat next door to me. They've listened, and I think we'll give that commitment if you can get it into your forward programme. It's a question really of whether and how much detail. We've seen with the SEND report that's going to come up in a minute, you know, that we try and then pick up the reports and do a proper officer report rather than, I was going to say, somebody who doesn't know what he's talking about.
I appreciate we're in the position, but I think we can clearly see that there is an issue, and it's how do we then move forward and develop something locally and national and impact nationally. So, and we know that we can do that.
Yeah,
so
and
thank
I think
you for that.
The issue with Sarah was the fact not just around home education, it was the role that child was potentially in social care. They knew about the problems and how did it all work together. So I think it's something that in terms of this report, the timing is just overlapped, but it does reinforce how important it is that we make sure that it's dealt with corporately as an organisation rather than just home education and being education, but it's about young people who are in care or AP. So I think it's a wider issue, and I think it's a perfectly reasonable question for you to ask us to come back with a bit more detail about that.
My other point is that we clearly seem to be looking at people who affect you in the home, people who violence reduction in the streets and those issues. But what we don't ever seem to discuss in this room also is the impact of social media and how that is an important element in young people's lives and the way we deal with the impacts of them psychologically, as we can see from various reports, we've got a huge amount of emotional and abuse issues going on in people's lives. So there doesn't ever seem to be any space for that. And again, I guess I'm not asking it as a question right now to be answered. I'm sort of thinking it more of as a policy development process. We know through a litany of stories out there in the press of what's been taking place and how that's impacting young people's lives, yet we don't ever seem to bring that into this room. So again, that's just a flag that I'm raising. The other thing that isn't in the report is, as you know, Paul, school streets. We would really like to have something to think more about how that is being worked forward and being developed. And then, on a positive note, just to say we have now got we've not got it, but we've been awarded the Tree of Hope, the Sycamore Gap Tree, for looked after young children, and it will hopefully be given to us next winter to be planted in Alice Park. And how, you want to now develop that and work with looked after children to how that happens. Very happy to hear from you, but it's looking at the map of where all those trees went. We are one of the few areas in the southwest, so that's good.
Just on the last point, Chair, when we had the Ofsted inspection, they reacted really well to that. So from my point of view, I think it was really nice because the Elliott's team actually took that on board and responded really well. We did also plant a positive tree in Pigeon Park, which was in the Care Leavers Week. So that was well received as well. So I think great credit to you for your initiative that you've done. And I hope that we've been working effectively with you about that, because I think it's a positive sign of our commitment to the young people who've come into care and then have to get care experience and move on. On the issue about social media, I think that's a good challenge, and I don't know what the answer is. We'll take that away and research that a bit more, because I've got to admit that that's not particularly my issue. On the school streets, I think I did provide information at the last meeting, and if there's further information that you want, is because it's with a different director that's dealt with in a different committee, but Andy Waite gave a commitment that he would keep you informed. Possibly what we could do is get Andy to come back in your forward programme to actually do a more detailed report.
I had to sub for Councillor Waite's previous meeting, and I brought it up and there was no response. So I guess I'm saying I'm disappointed by the progress and the conversation on that in that particular PDS.
Take that up then, Chair. Yes, I think you did ask which schools had volunteered, and you were given that information.
Thank you for those questions and their responses. I also have had a commitment from Councillor Waite that he would come to this meeting, not this meeting, sorry, our panel, to give us an update. I vaguely remember, I think was it in full council, that we did have an update on school streets, and there was a number being bandied around. I think there was 5 schools that had expressed an interest, something like that. So I think that report is available. It just seems a bit puzzling why it's not being shared widely at this moment in time. Also, I think maybe we could ask Becky Reynolds to come and speak around social media and the work that's being done from a public health perspective, and depending on timings, it might even be possible to do that for our January meeting, but we will have to check on her availability and whether or not that she will have all that information. And then finally, I just want to echo Paul's thank yous as well on the work you've done around getting that Tree of Hope. So it is very much appreciated by everyone. So thank you. So now David, and I just double checking, apart from Liz, you will be the penultimate. Yes.
Thank you, Chair. Question for Chris and Mary, probably. What happens when a child's parents take them out of school to home educate them, but they don't engage with your services or your school nurse?
That's where we do have a little bit of power. So if we are not satisfied that any arrangements are being made for a child's education, we can issue what's called a school attendance order, which is a legal notice which allows the local authority to place the child on the roll of the school, and then it would be then the legal responsibility of that parent to make sure that child has attended school.
And how many children in Baines do we have with one of those?
I would have to check that figure for you, but we can get that.
You know, 1, 2, 20, 100?
Yeah. It will be a few, but I'll need to get the number. If I get you the number for the last academic year, and the academic year to date.
Okay, yeah, sure, that would be great. I mean, I suppose the question is, you know, it's about how we stop the children falling through the gap, isn't it?
Well, I think that's a really important question, which Councillor Wright was asking as well in relation to about that, actually what would an ideal policy look like? And I think the education, the elective home education team in Baines is a really experienced one. We've managed to hold on to the coordinator and that team of staff for a long time now, and I think they would have a very clear idea in their heads about what good and safe looks like. But good and safe does involve some legislation being changed.
But, I mean, given people get towards retirement and everything, it would be good to have some of that knowledge down on paper, wouldn't it?
Yep.
In some way.
Organisational
memory and all that.
Yeah, no, we do have our own policies and procedures about what we follow, but I guess coming back to the challenge was what would we ideally like? What would be our policy if we had that within our gift? I think that's the question.
Liz. Thank you. I don't know whether it's the time to mention this now. I think, apropos of what's been said, it probably is. But I assume Laura Donnelly is going to appear at some stage because we have an educational healthcare plan, plans that she's going to talk to us about. She's also going to talk to us about home educated. And I believe she's also going to, there's a paper with her, with a briefing paper about home educated children. And I believe it's under her remit. No, you're right. Well, now I know. Now is the time to do this. And also about children who are hospital educated. So if that's all right with the panel, I'm going to bring these up now. And maybe if anything comes up that Laura Donnelly can answer in more detail, perhaps. Apropos following on what's happening, home educated children, we do have a list. There is a white paper has been published by the government, and they are looking at home educated children. But I do think we do need a policy. I mean, I'm just backing up with what Joanna has said. Sarah Sharif was removed by her parents. She didn't go on from being educated at school. And I think it's been said that having children at school is the greatest safeguarding we can offer them. So where did she go and what list did she go on? Because she was known to social services. And therefore, there must have been some list. So what I would like to know is how many of our home-educated young people are known to social services, are under social services. If we don't know, or if that's not readily available, this is something that should be on a policy, that we flag up these young people. How many are on free school meals as well? So we don't have this information as far as I know, but maybe it is out there somewhere. And again, when we're highlighting children who are educated, and I believe we ought to be looking at a policy, these are things that we need to look at. And how many of these young people who have special needs are on educational healthcare plans? Because we have an annual report, an annual visit rather, to children who are home educated, and that's it. That's as far as our commitment as a council goes. So I'm just flagging up, what about all these other things that relate to home educated children, the special needs, etc.? are these identified? Are they readily identified? And also, in the report it says, if concerns may be raised about the quality of home education being followed. Chris, you've mentioned that there is some sort of order you can raise that the child needs to be back at school, but what are the procedures? If you go to, if your annual visit, your one visit a year to children who have been home educated and you find home education is not sufficient, do you just raise concerns? Do you talk to the parents? Is there a follow-up? So I think there's a whole area there that we need to look at. So I'm going to pause there and see what you say.
I think it's really important, as I've said before, it's a really important issue to look at. Just to clarify a couple of things, elective home education, the service and what it delivers sits under Sarah Gunner, not under Laura Donnelly. But just to reassure people, that Laura Donnelly is in the building. She's waiting for me to message her to say, your writer's coming up next, so she can be there. And I just want to be really clear that we do have Bain's guidance. We have our own guidance about what we do. We don't do it. And again, just to clarify, I think what we were saying is if we had our ability to write a policy that we think should be national in terms of these are the things that we need, we'd be certainly welcome to, we can certainly look at that in a report that comes back here. But if you go onto the Bain's web pages, if you go back to North East Somerset, elective home education in there, you'll see the government guidance, the local guidance, information about our school nurse and our service area. So we do have guidance written down about how we deliver this in Bain's. And Sarah Gunner oversees that in a very, very clear, detailed way. Those who have worked with Sarah in the virtual school service know that she's very meticulous about what she does. So just provide the reassurance of this. And Liz, you asked some really good questions about EHCPs as well, so we can provide the numbers of children who are elective home educated with EHCPs because it sits under Sarah Gunner's service, that bit of it as well. So we made sure that all the children who are elective home educated are under the same service, so even if they have an EHCP, there will be circumstances where a child has an EHCP that we will deliver additional support that's in their plan, even though they're elective home education. So we will still continue to make sure that if they need speech and language, and that's part of their EHCP that should have been delivered in the school, the local authority to make sure that's still be delivered. So there's quite a lot of information we can bring in a further paper around EHE in terms of what it is and what we do, as well as actually what we think should change in terms of the law.
Can I ask that you circulate the guidance, Bain's guidance for home educated children? I'm sure it's out there on the website, but it would take me hours to actually find it. And I just think as a committee, we're quite concerned about this, not just, but particularly about what's happened to Sarah Sharif and lessons there for us, probably.
I think there's something about all committees across the country looking at this time. We should be expressing and writing Central Government Department for Education to bring forward those proposed changes. It has gone on too long in terms of those particular... Did I get political then? I didn't mean to. But I've sat here a long time and watched proposed bills, changes to this piece of the law, never make it through Parliament.
No problem about being political, but actually there's a white paper by the government on this, and I think we're going to see changes in the near future, but we might just preempt it a little bit by looking at what we do. One last thing I want to ask about with the permission of the Chair, it's about hospital-educated youngsters, and it's been brought to my attention a couple of things that do we do this? Because again, there are loopholes, there are gaps in some of the things that are offered for hospital-educated children. So what are the absenteeism rate for these students? And is there any situation where people might be marked present whilst not being seen by hospital education staff? For example, when pupils use remote learning. So just wondering about the absenteeism rate. Do we keep an eye on this? So, I mean, is this another way of children not attending school? Because there's no oversight of this. And it looks like children only become too ill for school at key stages 3 and 4. Is there a disparity here? Why aren't younger children becoming ill and therefore having to attend hospital school? And again, just looking at the remit of mental illness, what percentage of HERS children are with the service due to mental health issues? So 3 questions there.
As previously said, I think we'll have to bring some of that information back, so don't have that with me now. In relation to the oversight of their absenteeism, so the Hospital Education Service is run by the Partnership Trust. It's currently based on the second floor of Albert Alfage, and it is operated like a school, so it's a register. There are people phoning up, making calls, and we will have information about absenteeism as well, and we can provide that information. But the stuff around the mental health, I think I'd look to my health colleague to say that probably if you look at the numbers that are in CAMS, it is probably an older population, and therefore that's reflected in the Hospital Education Service in terms of the numbers of the older children who have been seen. But that, without looking at the detail of it, is a bit of a professional assumption.
Okay, many thanks.
Okay, Councillor May.
Chair, can I just, the first question you asked was how many on social care, and I gave you the assurance early on that we have looked at that. It's unfortunate that we keep hearing Councillor Mansell made reference to it. Every period of time there seems to be another case, and the scrutiny on social care is really, really quite enormous. So yes, we've looked at it now. And I'm pleased to say there's probably, I've been told not to say how many, but there's less than 5. So it is important that we actually do recognise that this is a real issue and we don't just then take our eye off the ball. So I think it's something that will give you the assurance that we've done that in detail now as a result of that really, really terrible death. I mean, I'm sure there's not a person in this room who hasn't cried a tear over it. And it is important that we actually recognise that the social workers have a major responsibility to act correctly and properly. And it's important that things don't fall down between the stools. And under those circumstances, we've got the great advantage that Mary is in charge of social care and education. So it's her role to make sure that things don't fall down between the gaps. And I think that's a responsibility she takes really, really seriously.
Thank you. Just to wrap up this, I just have a couple of points I want to raise. I mean, obviously we know that the numbers who are with CAMS are older. Is that possible? Is that possibly because of the difficulties and the time it takes to actually get that support, so they end up being older when they're finally being seen by CAMS? And then my second question, which I think would be very helpful to know, but I appreciate it would be difficult to be able to be absolute on this, is around those children that disappear from any lists. So they're removed from school and then they never appear on any of our, elected home education registers or any other list. They simply disappear, because I think those are going to be, children that will be most at risk. And then I have a question which I just want to ask my Vice Chair if she would be happy to circulate the white paper that she's referred to. Thank you.
Yeah.
I'll let my colleague Laura come in, but I may be completely wrong with my intonations around the CAMS numbers and doing that with the older children. But
I think that's something that would be helpful if we take away and bring back. As we know, there's many. It's complex in terms of access for CAMS. CAMS is where children and young people need a clinical diagnosis to be able to accessing CAMS. It's not the broader remit of emotional health and wellbeing. So access to CAMS, I think there are complexities around why there might be delays, and actually for some there aren't delays, there is capacity within that service. So I think that's something that if we bring that away and bring it back, that would be helpful.
And just so my comment wasn't relating to the capacity of CAMS or timescales of waiting lists, it just does tend to be that the children are older when they're referred to us and they've got social, emotional and mental health issues. Not a comment on the CAMS service itself.
I wasn't commenting on the CAM service, I was commenting on more the processes. And then did you have any idea about the numbers that disappear that are no longer on any list?
So the local authority has a responsibility for what we call tracking of children missing education. So any school that is notified that a parent wishes to leave or they've left and passes that information on to the council, we use then a variety of information sources to try and obtain where they've gone. All the local authorities should be doing the same. So if they've got children who have left the school without notifying us, then we have to go through a formal tracking process. We do have a list of those numbers. I don't have them to hand again. Equally, we have a responsibility to make sure that we're sharing our information with the local authorities when we know that as well. But schools in Baines, I would like to say, are very good at telling us when someone leaves a school role. So I'd like to think that we always manage to identify where children go, but I'd have to look at the numbers.
Thank you, Chris. Okay, right. Thank you, everybody. I think we have scrutinised our Cabinet member quite thoroughly. And I'd like now to move on to our next item. I just want to double check though. Councillor Jackson, are you happy to wait until the end of our listed agenda before you make your statement? Thank you. Right. So we now move on to Laura's item, which is the Baines, Swindon and Wiltshire Integrated Care Board update. So would you like to give us any further updates to the report that's been circulated?
Yeah, thank you, Chair. And just to confirm, I'm Laura Ambler. I'm the Director of Place for Baines, Swindon and Wiltshire Integrated Care Board. So the panel will have had our report in the pack and taking on board feedback from previous panels as to how we formatted it. Hopefully this works well for colleagues. We have got a number of things in the report. There's an update on Sulis. It's in the final stages of the building and the team are readying for a new wing in December. I just wanted to draw attention to 2 points around Sulis. One is that we are working on sustainable travel plans, and that has been a joint initiative working with the local authorities, so our thanks to local authority colleagues on that. And there are also some other sustainability bits of information within the report about the building itself, particularly around energy efficiency and solar panels and heat pumps being installed, and then around recruitment. So this new build will bring 100 new jobs to the area, both clinical and non-clinical. There has been significant interest already in those jobs, and we're pleased to say that we'll be inducting 30 new starters. The vaccination update gives an update that we have nearly given almost 500,000 vaccinations, and as we know, that's really important to protect our most vulnerable populations. So that's just a reminder in the report. We have physiotherapy performance information that was requested by the panel, and that is at Appendix A. And we also have information that's been provided by pharmacy colleagues within the body of the report itself. And then finally, Chair, just to navigate panel members, the final section of the report just sets out some new initiatives around supporting children and young people. There's a reminder that we use as an ICB the National Core 20+5 framework to underpin all of our work, and that measures progress against 5 clinical areas, including children, young persons, emotional health and mental health, asthma, epilepsy, oral health and diabetes. And so when we go through the rest of that section, you can see that the initiatives that we're looking at actually address those clinical areas specifically. So I'm really pleased to say that we've had a fantastic youth worker pilot that's been operating. That has a dedicated youth worker in each of our acute hospital emergency departments, including, of course, the RUH in Bath. They're provided by our third sector providers, and in Bath we have a brilliant service provided by Off the Record. So the youth workers are on hand. They deliver a person-centred, trauma-informed approach, which is really important, as we know, for any child or young person aged 11 to 25 who are attending a hospital due to mental health or as a result of a long-term condition, and where there may be concerns or where support may be needed about their emotional health and wellbeing support. The new initiative, we had a fantastic update within the ICB, and we can already see the impacts that that is delivering. In particular, it's reducing emergency department attendances, but critically, it's the experience that's felt by those young people and the support that they have felt, and indeed their families. This section also talks about, we've got specialist nurse pilots at RUH around epilepsy, and we also have, focusing on improving diabetes outcomes, we are looking at excessive weight clinics for our children and young people as well. And then finally, just to note in the report that we've launched our asthma-friendly schools accreditation. We're working in partnership with the local authority on this. Schools can access resources to become accredited, and as we know, that awareness and working on this programme actually has been shown to improve the outcomes for children living with that long-term condition. So I'll pause there, Chair, in case there are any questions from panel members.
I'm going to let Liz go first.
Well, this is an honour to go first, so thank you, Chair. There are a couple of things I wanted to ask you about, Laura. I have received information, this is where I was asking Mark Dunford and drawing him in on this, about the maternity trauma project that you have set up. And there's some lovely stories to say how it's helped women who have suffered trauma either pre or after pregnancy and childbirth. But we don't actually get information which I was asking for, which is there is a waiting list of 4 to 6 months. So that hasn't been offered. So I just thought I'd raise it here. And perhaps if we could get information on that, because obviously it's a great project to have, but if there is this huge time delay, you know, that we would like to see improved. And there are a couple of other things as well. The pharmacies, the figures are going up slightly, but I just wondered, do we need more? I mean, do we have information about outcomes and trends? Are more people using pharmacies? And I do believe that some pharmacies are opting out of the NHS scheme, so perhaps we could get more information on that. The youth worker pilot scheme sounds absolutely excellent, and it's really good to hear. But could we have some figures on this? For example, what are the trends? Are the off-the-record workers doing more work with them, less work, and what are the outcomes? And then finally, it's good to hear about the winter vaccinations that are happening, but some residents are saying to me that when they are getting information about vaccinations for their children, the schools aren't always informing parents where there's local provision for the children who need this, and it's not very many. But I know a resident got your child's eligible notice, but nothing about local places to get them or dates. The NHS app only showed places that needed a day's public transport travel, time off work. So is this an area that we need to look at? Maybe is it something that needs to go to schools to make sure residents whose children need vaccinations know where and when to get them? Okay, thank you.
Thank you. Yeah, I'll take each of those points in turn. In terms of the waiting list for the maternity initiatives, I have actually asked colleagues to follow up on that specific direct question. I don't have the answer today, but hopefully they will follow that up. The same colleague that I think you were copied into an email trail on that. So we will clarify that. In terms of pharmacy, Yes, I mean, clearly moving forward, the intention is that pharmacies currently and moving forward do have a significant role to play, as we know, in bringing things closer to the community. And so we are seeing an increased uptake in use of pharmacies. What I will do is I will ask colleagues if they can provide more information to quantify that. And I think we have put the information as we see it in the report already about those that are opting out, what the arrangements are and what the minimum requirements are in terms of core contractual hours and how you cannot go less than 72 hours per week. So our understanding at the moment is that we have coverage across Baines, and I think there was a specific question about opening hours after 5 p.m. as well. So we're not seeing any issues at the moment that I'm aware of, but I can go back and clarify that. I understand where the question's coming from. Youth Worker Pilot, yeah, thank you for highlighting that. It is a fantastic project. It is a pilot at the moment, so we need to think about how we look at that moving forward. We don't yet have the full evaluation on that pilot. We had some initial feedback, as I say, and I think it would be a great piece of work that might be helpful for us to provide more information, perhaps a slide deck, and maybe even ask the youth workers if they would come to the panel, if that would be appropriate. I'm sure they would be very happy to. So we can provide that information as and when it's available. But what I would say is that already we are seeing the impact. I have no doubt that evaluation will be positive. And we've also had that lived voice experience. So the anecdotal evidence, whilst it is anecdotal, it's also lived voice. And as we know, that's really important. So I would certainly take that away as an action and be guided by you on what level of information you want and whether that's an item. In terms of school vaccinations, that's a really interesting one. Again, I have not been made aware that there has been any lack of clarity of where people can access vaccinations, and particularly through schools, programmes, etc. So if it were appropriate, if you could pass me on some information just so that we can look into that and make sure we don't have any gaps. And certainly I'll take that feedback back to our vaccination team just to make sure that we are getting the relevant comms information out there to all of the channels available. I think that was the points covered.
Thanks, thank you.
Thank you. And I'm not sure if it was clear to everybody, but you should have received an email around about 9:15 around the maternal mental health service, also known as Ocean. Okay. Sorry, David, I'm just checking whether you're next on my list. You're not. It is Kevin.
Thank you, Chair. Laura, thank you. Three areas, bits. One is
You've got your microphone on.
It probably is. It's probably me trying to look at notes in the wrong direction. Apologies. So 3 areas. One's around vaccinations. We hear a lot about the pressure on hospitals and the vaccinations being so important. Do you feel that the ICB are able, at the moment, with the strategies you have, able to maximise uptake? And what are you doing around that maximisation bit? Secondly is around pharmacies. I just wondered what the pharmacists are telling the ICB about how they're coping with new demands placed upon them, and whether the ICB is content with the pharmacy provision, or are there weak areas that you're trying to tackle? I believe you mentioned back in April a pharmacy strategy that you were working on, and whether that's been developed now, or whether it is out there and we don't know about it. Or I don't know about it, sorry. And the 100-hour pharmacies reducing their opening hours, is there any particular concerns you have on that as a result? Then finally, around the new initiatives, which again, fantastic. I've already declared interest that somebody's working in that area, which is great. It sounds very good. Is it new money? Is it from existing resources or things? Because obviously it's around prevention, I'm assuming. And if there's an issue around emotional and mental health, Is that an area then for CAMS? And is CAMS able to cope with the extra referrals, or are things being prevented from getting to CAMS because of this? Thank you.
Thank you very much for those questions. In terms of the vaccinations and do we feel we have what we need to maximise uptake, I think we're confident that certainly when we look at benchmark data, we do very well in terms of getting vaccinations out there and also the uptake that we have. As with anything, we're reliant on everybody to come forward and accept those vaccinations when they are eligible. We also outreach into places, so we're not just waiting for people to come to us, we go to where people are. And we have put quite a lot of effort, as you will have seen, in our vaccination campaigns. So I think we are comfortable that we are heading in the right direction. But as always, and you'll probably hear us, anybody from health in every single meeting, that's why we always have vaccinations in our reports, because it's just important to keep reiterating and keep getting the message out there. So particularly this year, the reason why it's particularly important, and I think, you know, it's been reported in the press, hasn't it? We know that there are significant pressures in our acute hospitals at this moment in time. There are actual particular strains around flu, which are, providing, pressures on our healthcare and COVID. So it is really important for those reasons, as we all know, as well as protecting the most vulnerable in our communities in any event. So, yes, I think that's all I can say on that one. In terms of pharmacies, as I was saying, we've no immediate concerns around the contracted hours at this moment in time. There is an ongoing review, and I think it would be prudent if we asked our pharmacy colleagues to come back to give an update on that, if that would be okay. And then in terms of the new initiatives, and in particular the youth worker pilot, that is from within existing transformation resources, so it is a pilot for a period of time. And indeed, it is focusing on prevention. What we are seeing is that it is, as I was saying, having really good outcomes, and we know that it is impacting and reducing the admissions to our emergency departments in particular, and also supporting those who are in a hospital setting, either through mental health or because they've got a long-term condition. So we can see already the impact there, and hence we need to review and have a look at that more formally moving forward. The question around CAMS and access to emotional health and well-being, CAMS is not everything. When we talk about children and young people with emotional health and well-being needs, it is about meeting the need that is being presented, and in some instances there may be a clinical diagnosis which means that that child or young person is appropriate for a referral through CAMS. But in other instances, it may be another type of early support help. And so, as we know, we have the youth worker pilots at the moment in our acute settings. You may have recalled in previous panel meetings, we've referred to things like the key worker service with learning disability and autism individuals. So there are a range of other services that we rely on and that we provide that wraparound holistic support to children and young people with emotional health and well-being. I think there is perhaps a myth that all of that goes through the formal statutory commissioned CAMS, and actually in some instances that's not the case, and in some instances that's not the most appropriate thing that is needed to meet the child's needs. So there's a range of services, I would say, that are offered to support our children and young people depending on the need that is presenting itself. So in that context, the children and young person being able to access the support that they need, it's about us identifying the need correctly and accurately, and then making the right referrals and getting the right support for them. In terms of CAMS, again, as I said, I'd prefer to bring a report back on that, because I think the complexities of accessing CAMS, it's not as black and white as, waiting lists being full or people not being able to access. There are different reasons why different people will be accessing things at any one time, and the waiting lists that are as a result of that.
Thank you, Laura, and thank you, Kevin, for your question. Joanna.
Thank you for your report. On the asthma-friendly schools, again, I think it's interesting that the whole emphasis is put on the school and the young person with the asthma, and it goes back to school streets, that essentially we've got an air quality issue, and it's how do we support that and how do we not get siloed. So thinking about the other scrutiny panel, the work of school streets, the work of air quality, the work of the asthma-friendly schools, and how we shouldn't be siloed within any organisation. I'm just wondering if there's a greater conversation to be had across this piece that actually brings those whole issues together. Therefore, the reason we want school streets is because it's a public health issue about children getting to school safely, and then when they're at school, that those spaces have clean air. And I just wonder if there's something around that we could consider. Thank you.
I'm sure there is, and I will link in with my colleagues just to make sure. As I say, this is a joint initiative with local authority colleagues, so I'm guessing that would be through Sophie Broadfield and others. So if I take that offline, Councillor Wright, and just make sure that those linkages are there, I'm sure there is, as I say, because it's a joint initiative, but I'd like to clarify that.
Okay, thank you, Laura. And it might well tie in with a rollout that I think started during the pandemic of various monitors around air quality as well, so it'd be useful to maybe pick all of that up, because that also touches a little bit on the COVID sort of angle that Councillor Harding was interested in as well. So, I'm talking of Councillor Harding. This is your moment.
Thank you. Laura, last year and the year before, I think I'm right in saying around only half of children who were eligible for school flu vaccines got them. So I just wondered how that was going this year, and what we're doing to kind of improve it.
So I would need to go back and check the data. I must admit, I was not aware that it was... Did you say only half or less than half? I mean, either way, it's
half,
not...
from year 7 to 11.
Okay.
I think that's around. And you know, and part of it is about improving the sort of herd immunity to the flu and the impact potentially on granny, rather than at that age necessarily their own health, which is part of the problem, whereas obviously your baby getting flu is a different ball game and more serious.
Spot on. It is about protecting our most vulnerable, and that's why it's important that everybody that's eligible has the uptake of the vaccine, including school children. I will take that away and have a look at that data. I haven't had it flagged to me that we've got a particular issue in any of our age cohorts, but thank you for piquing my interest as well. I'll check that.
I think that's nationally, and we are slightly better than nationally, and in some areas much better than nationally, and as you said, in all our vaccination schedules.
Yeah.
And, sorry, part 2 question. I just wondered if you knew or could give us some data on what the adult COVID vaccination rates are, how many people eligible and actually taking it up. Thank you.
That breakdown, I can send that across.
And on that, actually, it might be useful to know if there's been a change in the uptake in those getting vaccinations who have to pay. So I know that the price of those vaccinations has also gone up quite significantly over the last year, 2 years. So that would also help in that sort of herd immunity question too. Okay, so I now have Leslie, and then finally Ruth.
Yes, thank you for the report, Laura. I don't mean to sound ungrateful, but could we have it in an accessible format, because the font's a bit small on this one. I want to pick up on vaccinations. So you've looked here at flu and COVID. How are we doing on measles vaccinations? And are we seeing people now reporting that they're contracting measles. On the community pharmacies, now I'm not quite clear what constitutes a community pharmacy. I'm presuming this is a pharmacy that's not in a hospital. But the hours that we've got around where I am, for example, in Radstock, the local chemist is open between 9 and 6 Monday to Friday, but on a Saturday it's closed. At Westfield, again, it's open Monday to Friday 9 to 6. On a Saturday it's open 9 to 1. And in Midsummer Norton, much better, so Monday to Friday it's 9 to 9. Saturday it's 10 to 7 and Sunday it's 9 to 7, which is fine if you can get across to Midsummer Norton, because there's no bus service from Hayden, for example, across to Midsummer Norton on a Sunday. There are in the week, there are a few, but not many. And the other thing I wanted to pick up was on the physiotherapy figures. So fantastic to get them finally. It took a long time. But I wanted to ask, are these average figures? Because it says the waiting time for routines is 19.3 weeks, but I've got residents coming to me saying it's 7 months. So are these average figures? And what is meant by routine as opposed to urgent? And I recognise that the service is seeing increases in requirements for the service. We heard earlier on that there would be, I think, more people coming in to provide the service. But I'm a bit concerned that these figures are going up and up, but I'm not quite sure what they all relate to. Thank you.
Thank you for those questions. In terms of the other vaccinations, again, that's something I can certainly ask our vaccinations team to provide information on. I'll make sure that I capture that and get that in a timely way ahead of the next meeting. Around the community pharmacy, obviously in the report what we've set out is our understanding of the coverage, and as I say, at this moment in time we're not flagging a particular concern, because as we know that review is currently ongoing. What might be helpful, Councillor Mansell, if you could email me, I see that you had quite a bit of detail there in your notes, the areas of concern, and then we might be able to confirm our understanding around those areas that you have the most concern about in those local areas. In terms of the physiotherapy information, it is average waiting times that you've got in your slide pack there. And obviously it's difficult to comment on an individual case. I'm sure that there will be some cases that will be beyond that average waiting time, obviously, what with it being an average. But again, if there is a particular case or concern, it might be helpful to understand a bit more around that. In terms of what's driving those numbers, I think as we heard earlier, you will see that there have been significant increases in demand, and I suppose a couple of observations, if you like. Whilst referrals have increased and new patient contacts have increased, what we're seeing is that that increase far outweighs the waiting time increases. So that extra demand is being absorbed, and quite significantly so. So I would say that hence the current feeling is that this service is performing very well, albeit that we're not quite, as we heard earlier, at the 18-week target. There is a recovery plan in place with both workforce and resources to get that back on track. But you will see that the significant demand increase is obviously driving that. And yet what you'll also see in the friends and family results is that above 90% would still recommend those services. So yes, by all means, it would be helpful to understand if there are individual cases that are causing concern. but they are average wait times that are listed in the report.
Leslie, do you want to put your microphone on?
Sorry, I thought it was on. Can we just come back on the physiotherapy figures? So, bearing in mind quite a number of people who want the service are actually disabled or elderly, not all obviously. Is there any quality impacts assessment on this that we can see as well? Thank you.
Yes, I think all of our services have that type of information, so I can certainly take that away and bring back that relevant information. And again, I think it's just acknowledging it's the significant demand that we're seeing post-elective recovery in our acutes as well, as we heard earlier, that's driving some of that demand. And we are minded that there is a plan in place to get back on track for that target date. Despite all of that, I hear what you're saying, Councillor. Obviously, we understand how needed this services is and how important it is to individuals. So, yeah, absolutely, we'll get that equality impact information for you.
Okay, and then my final set of comments and questions comes from Ruth.
Oops, all right, thank you. Thanks, Laura, for your report. I just wanted to talk about the first time through this hospital and the extension. That all sounds very good. And interested to hear about the sustainable travel plan. And then I was thinking, I don't know if it would be possible, but as Councillor Wright has already said, there is a certain overlap between this to do with active travel and a sustainable travel plan being looked at here in light of the fact that we're responsible also for scrutinising public health matters. With the other PDS panel on climate emergency and sustainability. So would it be possible to ask Lucy Travis, or, for example, to, or somebody from the RUH or Sulis Hospital? But in my case, I'm particularly interested in the RUH. I have to say, of course, because I'm a Western councillor, and how they manage the travel plans of both staff and visitors impacts quite a lot on Western and Newbridge. So I would be very keen to have a bit more information about the sustainable travel plans of the RUH and the Sulis Hospital, if that would be possible to bring it also to this panel. As I said, because it has an impact. How people move about has an impact on air quality and general health. You know, thinking ahead, it all sort of ties in, doesn't it? The more people are able to get about under their own steam, as it were, then hopefully we'll have fewer health problems looking ahead. So is that possible to have somebody come and talk in this to this panel?
So we were just talking about whether that would be appropriate, whether it should come to this panel, whether it should go to the climate emergency panel. I think we'll just double check exactly where the most appropriate place would be. I think the overarching piece of work would probably go to the climate emergency, but it might be appropriate to have the specific plan for the RUH come to here. But we'll take that away and just confirm what would be the right thing to do there. But obviously, as the ward member for Western, it could well to come to you as well. Anyway, Ruth. Sorry, Laura, did you want to add something?
No, I'm very happy with that, and of course I'm very happy I can add further detail into our reports as that emerges on what the sustainable travel plan actually looks like. And obviously at the moment, as contained in the report, there are plans around an initiative in encouraging with staff initiatives and things like hiring e-bikes and charging points, etc. We can provide more detail on that if it would be of help, recognising that the wider issue, I'm sure, does go to the other panel.
Thank you, Laura. Right. That finishes that particular item, and now we move on to the Independent Reviewing Officer's annual report. So, Paul, do you have something you wish to add to the information we've already received? And then finally, Sarah will get to speak about this item.
Thank you, Chair. Welcome, Sarah, who I think you've seen before, at the committee to do the report. And just to make the point that I haven't edited this report in any shape or form because it's an independent report, and under those circumstances there's one or two areas in there which we need to take very seriously ourselves. But I think over to you at this point, Sarah.
Thank you. I think that's a very helpful bit of information, and you might want to turn your microphone off.
Thank
We might want to have a little bit of IT help here.
For ease, Chair, as I don't need to use mine. Let's just
Okay,
do that.
thank you. Thank you, Mark.
Let's do that.
Thank you. Apologies. Hi everybody, I'm Sarah Hogan. I'm the Head of Service for Children's Quality Assurance and Safeguarding. So I manage the Independent Reviewing Officers for Bath and North East Somerset. The report that you'll have been provided was actually prepared by Michelle McKay, who is the Interim Head of Service. I was absent from work on maternity leave for a year, so this reporting period was very much covered by Michelle and her leadership. So I think, first of all, just to acknowledge that you'll see from the report that there were some real challenges within the service between 2023 and 2024, a lot of unexpected absenteeism, which then had an impact on the quality of service that we aim to provide. I'm really passionate about our children in care and making sure that they have a really good quality IRA service and that they are able to build really safe and secure relationships with their IRA. Unfortunately, this year, children experienced a number of changes of IRO, or as you'll see in the data, child and care reviews weren't happening as planned and within the statutory timescales. That's not something as a service that we are proud of, but equally we weren't able to anticipate some of those challenges that arose. I did just want to take a moment, though, just to acknowledge that during this period we did have the sudden death of one of our children in care who was 17, she was approaching 18 years old. There was a child safeguarding practice review report done as a result of that child's death, and some learning for colleagues across children's services, so colleagues within children's social care, adult social care, and also the education service as a young person in our care receiving education as a looked after child, and the IRA service. It's always really challenging for services, I think, to participate in those reviews because looking at, with hindsight, difficulties or areas of a young person's life that could have been perhaps considered further is quite, it feels much easier after an event rather than in it, but there was definitely some learning. So I just felt it was important that as a young person in our care that we acknowledge the passing of that young person. In terms of the IRA service, I think there were two key core areas for the IRA service to think about, and that was about how we escalate and challenge some of our colleagues across health, education and children's social care. So when an independent reviewing officer isn't satisfied that areas of a child's care planning is progressing adequately, that they are actually following a really robust escalation process. So you'll see within the report that there's reference to a dispute resolution protocol. So that's a recommendation of the IRO handbook, which hasn't been updated since 2010. And I think lots of IRO managers and IROs themselves would advocate, and we do nationally, that does need to be looked at in more detail and revised. So one of the expectations is that every local authority has its own local dispute resolution protocol. There's a real challenge in an IRA service because your remit is to ensure that care planning for children in care is progressing, but equally you have to take on board some of the challenges that we may face within services ourselves. So nationally, we're seeing significant changes in terms of being able to access services, in terms of social work practice, in terms of the cohort of social workers in terms of experience, the age of social workers. The research says social workers stay in safeguarding roles for approximately 2 years after qualification, which is significantly different to 20 years ago when I qualified as a social worker. So So I think one of the areas that we've reflected upon as a service is what are the barriers to IROs in making formal escalations and challenges, and I think it is trying to find that balance around working with colleagues in a respectful way and a courteous way, whilst also championing for children in care and what they need. So in relation to the young person Sky, the IRO absolutely was raising areas of care planning that needed to be progressed, but wasn't perhaps utilising the formal processes in which to do that. So there was clear evidence to Sky, for Sky, that the IRO was acting in her best interest, but perhaps they hadn't always used the formal challenge. So my colleague Michelle McKay started to look at the dispute resolution protocol within Bath and North East Somerset, and to look at how we can strengthen that process. And then when I returned this year, following, I suppose, coming in from a different lens, this being a service I've worked in and been head of for nearly 6 years, I made some further revisions to that. So we relaunched the dispute resolution protocol in September, with the ethos of that being, for me, to be able to generate a greater sense of what the themes and challenges were for our children in care that IROs were identifying, and then looking, therefore, with colleagues within children's social care about how we can kind of take some of those themes forward, learn from them. We've strengthened our reporting, therefore, in how we collect that data, therefore how I can summarise that data. So with that DRP, for short, being revised and reintroduced in September, in Q4 of this financial year, I'll be able to start reporting on themes through our service improvement board within children's services. So that was definitely an area I think that we've really kind of taken focus from Sky's review and taken those recommendations forward. So moving on from Sky, just to kind of, I suppose, provide a bit of a snapshot. Hopefully you'll have all had an opportunity to read the report, and I appreciate it's a very lengthy report. But there were 359 children in care at the end of 2023-2024. That is quite a significant number of children for a service that has 6.4 full-time equivalents. Our children can be placed as locally as Bath, as equally as, far as London, Birmingham. And whilst children's social care work tirelessly to try and ensure children remain connected to their community and remain placed locally, that is a significant challenge that nationally we're seeing. So an IRO can spend a whole day, I had someone last week spent 7 hours on the road to meet a child to go and see them, because they're really committed to fostering good relationships with our children in care. So, sometimes you can have an IRO kind of out of their, if you like, virtual office for kind of 3 out of their 5 days. So it's a really significant challenge as a small local authority with fairly small numbers in comparison to larger local authorities. So when there's any disruption in service delivery, it's really difficult. We don't have that kind of flex in the system to kind of step in and to cover. So sadly, for some children in this reporting period, they didn't have their child in care review within the time frame that we ideally would want them to have. But what I would say is that IROs do know their children incredibly well. Returning to work after kind of 14-month absence, I was kind of blown away by how IROs could bring to life children. They were able to tell me with real confidence, these are the children that you need to know as head of service, these are the children that I need to talk to you about. You'll see that, within the report, hopefully you'll see that, we accept that there are areas that we need to improve upon. So you'll see our child in care review timeliness was not in line with what you would have seen had you seen previous reports that I've written in previous years. And so just to give some assurances that in Q1 of this financial year, those figures were up to 92%, and then 98% for Q2, and I'm hopeful for Q3, and we're still in Q3, that we're kind of in the mid-90s. So I suppose just to give you some assurances that those areas of performance have already improved. I brought to this meeting and raised in previous corporate parenting boards our requests that we need to send our notes of our records to children and their families and carers within 20 working days. That's always been a significant challenge, and Baines isn't alone in that. I meet with my colleagues across the region, and all of us have this real challenge around the report writing of reviews being sent out within those 20 working days. And so we have kind of turned our attention to look at how we can support IROs to get those reports done in a timely way and significantly increase what's a really poor area of performance within the service. That doesn't, however, mean that children aren't seeing their IRO, having their review, that the actions and recommendations from those reviews aren't known. They are known about. This is more providing evidence and a summary to the child, the carer and their family about what needs to happen and by when. There's reference in the report to weekly completion sheets being introduced, and just so as not to kind of mislead anybody, when I returned, I did take the decision to remove that process. Following a review and feedback from IROs, we felt that actually it was a lot of repetition, and for IROs who already have a volume of written work to do, I just felt like it was adding to their to-do list rather than helping them. So we've looked at other mechanisms within the service about how we can monitor kind of child and care review timeliness, the records of those, the completion of midway reviews. So you'll see in the large percentage and large cohort of our children in care are over 10 years old, and that their plan is to remain in local authority care. So what we foster and try to promote is that the IRO will have that longevity of relationship. So nothing should change in that relationship unless the IRO leaves the service or the child requests a change, which can happen. And we have to recognise, sometimes you don't always gel with somebody. So, with that, we're this year starting to think about how we can support children to, I suppose, claim their child in care reviews and actually hold, take more of a lead and ownership and realise that they're their meetings and try and take that kind of formal lens off it for them to get their greater participation and buy-in. So that's a piece of work that we've started as a service since I've returned. You'll see at the end of the report there's some areas around service development that we'd like, and feedback. I have been here probably too many times saying to you, we just haven't cracked it. We have now started a working group, which I implemented from July, and we're looking at exploring various means in which to obtain feedback, the use of QR codes, speaking to young people, telephone calls across the service, kind of a like customer service kind of call, and like mystery shopper, which has been successful in some areas. So that is something that I would hope, if I'm here this time next year, I'll be able to give you some feedback around actually what our children in care and their carers and family are saying about the IRO service. I've also introduced for next year, because of, I think, some of the areas that this report flagged to me upon my return, a kind of the difference that IROs make, because I think what this report doesn't capture is the significant difference that an IRO can make for a child in care, and also for, a space for social workers often to kind of reflect with and to talk about children and the complexity of their needs. It's really hard responding to children's needs because they can be incredibly fluid. So next year I'll be here, hopefully, presenting with you kind of the difference that IROs have made and the progress in some of those areas that were identified through the CSPR.
Thank you very much, Sarah, and well, first of all, welcome back and congratulations, and yes, and thank you for your comments and reflections on the report. Okay, so oh my goodness, flurry. So I'm going to take Liz first, and then I will go Onkar, David and Kevin.
Thank you, Chair. I would like also to reiterate what Dina has said. Welcome back, and I think you're making a difference already. Timeliness has always been a problem, hasn't it? But it got particularly worse, and I think you said it during your absence. I mean, we've got to mention that something like 29% of children in care review records within the statutory time of 20 working days, just 29% were met. So it's quite low, and I know you've mentioned not just the fact that there's always been a problem with this, but also that there was a huge amount of staff sickness, which has had obviously a big impact on this. And you do mention that some of the problems and the difficulties are with social workers having these pre-meetings prior to setting up these reviews and recording information. You've hinted at that, and I just wonder, is this somewhere where, we've got the head of social services here, is there a conversation that needs to be had, or are you confident that this is moving forward? And I was very interested in your dispute resolution protocol. Who's the dispute between? Is it between what a social worker is saying about the child and what the IRO officer is saying? Is it between parents? So I just wonder, looking through all the information, and thank you, it's such a thorough report, I just picked out these issues that really I would like some clarification on. So thank you.
Okay, thanks for those questions. So the Child and Care Review record timeliness, so as I said, review records are meant to be distributed in 20 working days of a child's review. Now, a child's review can be over 3 stages sometimes, because the child may not want to be part of their meeting for any reason, so the IRA would meet with the child. They then might need to meet with the carers separate to family members for various reasons. So I think sometimes the data is looking at that first stage, so sometimes it can take 20 working days to then kind of complete all stages. I think the biggest challenge this year was surely capacity of IROs. I've not gone into supervision with an IRO without one of them saying, oh no, we need to talk about my timeliness, I know. So what I've always wanted to ensure is that children are having their reviews. That's the most important for me, because that's the place where you get an update on how that child's needs are being met, how the child is feeling, areas of need that haven't been identified or may need to be progressed in a particular way. It's where you also formally hear the voice and the wishes and feelings of that child about their care planning. So for me, I have also kind of thought, well, I've got someone travelling all day, would I rather they did that review and their review record was 3 days over the 20 days. If you'd looked at reports I had done, obviously I didn't do this report the year before, I looked at how many were beyond the 20 plus days but before 25 days, and actually quite a significant proportion were. So I think it's really difficult to kind of say this is how many were sent within 21 days, 2 days, 25. It's a real challenge, and I don't know what the kind of answer is to addressing that, because we just, with the volume of work, the out of areas visits, the phenomenal amount of reading that an IRO has to do, as well as phone calls, reading all the expert reports that come in about a child and their family, speaking to family members, visiting children. It is just a real challenge, but it's not one that goes unnoticed or unreported on, and I do always keep a really close eye on it. I hope that we will start to see an improvement this year with our workforce and the IRO service now returning to kind of some stability, and with a great shift on that, thinking about particularly for young people kind of what, for them to get their own records. It's really important to us. What's the point in writing them if they're not seen by the child? So it's a challenge that I think at the moment we continue to have, and hopefully this year we're going to, there are some changes that will lead to some improvement in those figures. Staff sickness is really challenging, because it's not, you can't predict, and we don't, as I say, and I said in the report, we just don't have capacity within the service that if someone's off, it is all about what can we do, how do we best manage. It's certainly areas of practice that will be formally raised with Director of Education and Safeguarding and the Director for Children's Services if we're not being able to fulfil our duties. And particularly before I went off, that was something that was starting to kind of surface. We could preempt some challenges in this reporting period. The social work reports for child and care reviews, upon my return, I identified that was something that had been raised through the CSPR for Sky, and equally through some of the data. So I did an audit in June of this year to look at, in a 2-week period, which involved approximately 26 children in care reviews, how many of those didn't have a social work report, and actually it was much more reassuring. The percentages were greater in terms of how many had a report and how many didn't. However, we've entered into dialogue with heads of service within care outcomes and children's safeguarding children's services to talk about how we might manage this where this issue does arise, because it's not okay, and there's definitely a commitment from colleagues in children's social care that children should have a social work report. So we are seeing an improvement to where it was this time last year. And then in terms of your last point around the dispute resolution protocol, that process is about where there may be a difference of view. So if I could just give an example where you may have a sibling group who are unfortunately aren't able to reside with their family, and also because of the size of that sibling group, they may have to be placed with different carers, and then looking at final care planning, an IRA might consider what's being proposed in terms of where those children live longer term, how they see one another, how does their relationship get promoted. So an IRO may talk to the social worker if they're not in agreement, but if that doesn't reach a resolution between the two parties, then they will access the dispute resolution and escalate up to the line manager, the team manager, the head of service, the assistant director, and then the DCS. So there are five stages to our DRP process. I've worked in Baines for a long time. I've been in this role for 6 years, and I think I've only had one that's gone to DCS level, because we've always managed to resolve for the best, the best outcomes of children. Also, the court arena, does make the final decision, and so, we can give our views to the IRO will give their views to the court and hope that they'll be taken into consideration and speak to the child's guardian. But it's also a positive process. The resolution is about kind of thinking about what's the best outcomes for children. But I think the lens of it is seen that it's quite negative. But actually it's about saying we've got a professional difference. So how do we resolve that? And sometimes we need to bring other people into that. So I have an oversight of all of the use of the DRP from stage 1 to 5. And as I said, the new process that came into place in Q3 of this year, I'll be able to see the themes, how many stage ones were made in this month, how many stage 2s, what were the theme, are there particular teams that are revising within children's social care or particular children, so that will help us kind of get a greater analysis of what the use of the DRP is. So hopefully that's given you some assurances.
Very thoroughly answered. Thank you very much. Thank you.
Thank you. Onkar.
Thank you, Chair. So I got a few questions. So in terms of, just to start with, this revised DRP. So how is the revised this dispute resolution process being monitored for effectiveness, and what improvements have been observed since its implementation? So that's the first part, and probably the second part of the same question, as mentioned on the report, on the escalation protocols. So are there clear escalation protocols in place for unresolved disputes, and how are they being enforced?
Certainly, thank you for that. So the DRP was initially revisited and reviewed in January of 2024, which is what the author Michelle McKay refers to in her report. As the permanent head of service, when I returned and I saw the learning from the CSPR, I looked at some of the data within the service, and then I looked at the DRP. I felt we needed to strengthen it, so I revisited that review from January. So under the Bath Community Safety and Safeguarding Partnership, the BCSSP, because one of the recommendations in relation to Sky was for it was a formal recommendation that there was a review of the DRP process within 6 months. So in June, I provided an update to the BCSSP that I was actually revisiting that review because I felt it could be strengthened, and then provided them assurances in September that this was the new protocol. It's been done in a more collaborative way, so I've been able to kind of think it's not just me writing this, it's about getting feedback from IROs, talking to colleagues in children's social care who are often the recipient of the escalation or challenge. So that's been in place. As I said, it launched on the 27th of September, so we're really early months in, but in Q4 of this year, I'll be able to kind of get a greater sense of how successful it's been in terms of its impact, the outcome for children, and certainly something that, if you wanted additional information on that, I could bring that back or feed that back to Councillor May or the Director of Children's Services. The escalation protocol is the DRP protocol, so I may have misunderstood your questions, but an unresolved dispute, if we exhausted all 5 stages, then I would hope we'd never get to that point, but we do have other means in terms of an IRO can seek independent legal advice and can also refer to CAFCAS, who provide guardians to children in care who are subject to care proceedings, or equally refer to CAFCAS if they no longer have a role, if they have a concern. Fortunately, we've never been in an incident where we've had to do that, but that is a resource that's available to us, to IROs.
Thank you. And in terms of like a feedback, so page 63 of the report, so as it says here, obviously this area continues to be developed and feedback forms are not completed, and QR codes are an area of consideration. So my question is, so what are current mechanisms are in place to gather feedback from children, families, carer about IRO service, and how is this current mechanism to getting feedback being used to drive improvements?
So at the moment, we don't have a formal process in place. So over the years, we've written to children individually to seek their feedback. We've sent them a consultation form after every child and care review to get their feedback. And we've done the same to carers and families. And we even provided self-addressed envelopes. And I think in 1 year we got about 17 responses. So if you think about, in this instance, there were about 566 child and care reviews. If you looked at the kind of breakdown of numbers, it's not representative. But we also have to recognise that children in care, they feel like their lives aren't their lives sometimes because they have so much state involvement. So at the moment, IRAs speak to children before every review to ask them about their experiences as a child in care and any dissatisfaction they have or things to celebrate what they're pleased with. Carers will formally feedback to IRAs. I can be contacted. We also have a complaints procedure available to all children, carers and family members. What we're trying to do is think about how we might be able to provide a platform which is accessible much more readily and when someone might want to give feedback, so including a QR code that might take them to a really short questionnaire that goes out on invites or review records, or if the child is sent a letter by the IRA that it's got like a QR code. Children are consulted, they are sent consultation forms, as are their carers and as are their family, before every review, so they can kind of provide feedback about the IRA service or other services working with children. But I think we just haven't got something that's embedded within the service that then kind of impacts and, helps us with service delivery. So I started a working group in July because we've been trying to, I think, address this for a number of years. Not to place all the blame on COVID, but I think COVID practices, how we practice changed, and then just kind of challenges within the service. It hadn't been an area of focus, but we're very much shifting that now. So the working group, we've had 2 meetings, we've got some ideas, we're looking at what children's social care colleagues do in terms of obtaining feedback, and I feel really confident that this time next year we'll have some really clear feedback processes in place and results from those.
Thank you. And my last question, in terms of reviews and staffing level, so what measures are being taken to ensure the IRO service maintain full complement of staff to avoid disruption, and what steps are being implemented to improve the timeliness of CIC reviews and ensure they are held within statutory time frames? Thank you.
So there is a commitment to the IRA service in Bath and North East Somerset. So in terms of absences, if we anticipated a longer term absence, there would be much earlier identification of interim measures. So we would look to either recruit agency IRO, so locums, or we would look to kind of look for fixed term contracts. We did secure some additional funding for a post to provide extra capacity, successful, but not something that's going to continue into this financial year once that role comes to an end. So early identification of any changes in recruitment, so if we've had any resignations, commitment to kind of getting agency IROs in place, and they're the kind of only measures that we have. But I work closely with the Director of Education and Safeguarding and the Director of Children's Services to kind of talk about any potential challenges arising through resignations or job opportunities within the council that members may take within the service. But I can't guarantee that there won't be a period where we have some areas where there isn't an IRO in post, but I am actively and always actively pursue to recruit to those.
Thank you, Sarah. David and then Kevin.
Thank you for your report. 57% of children in care placed outside of the local authority area. Is that right?
Yes, so they are beyond 20 miles from their home address.
What's been done to reduce this?
So that's a national challenge. It's not just Bath and Somerset. And there is lots of work being done to recruit foster carers within Bath and North East Somerset. There was a huge piece of work done last year so quite a few of the unaccompanied young people, when they first arrive in the UK, they are placed, say for example, by Kent, and Kent might place them in London, for example, and then they don't want to come to Bath and North East Somerset, although they've never been here. So lots of work was done last year, and we saw a number of our unaccompanied young people returning to the local area. Bristol would class as being outside of the local area, but I would say that it's not that significantly outside of the local area. You can still feel connected to Bath and North East Somerset, and relationships are easier to foster and navigate. So we work with our colleagues in children's social care. There is lots of under the transformation work through children's services, looking at kind of increasing fostering, looking at skills, pay and reward, training, looking at how we can kind of, increase new foster carers, keep foster carers. So yeah, it's a challenge, but there's lots of strategies in place at this time under transformation, which I'm sure Mary Kelly Knowles at DCS would be able to nominate an officer for a report if one was requested.
Thank you. Just follow up, if I may. Are you optimistic? Are you optimistic that this strategy is going to work?
I think central government needs to offer some support to local authorities to address this. We're asking people to care for some of our most vulnerable children, and they need to do that with systems around them. So there are some initiatives in place. So in Wiltshire, there's the Mockingbird. So it's around having a system around foster carers to support them. So I'm hopeful. I don't know if I'm optimistic, but I'm hopeful. I think I'd probably leave it at that.
Thank you, Sarah. I'm sure we would support you in your hopefulness too. Kevin.
Thank you, Chair. Thank you, Sarah. A couple of points. Is this on the right place? I'm not going to speak to you at the same time as looking. Just around absenteeism, just concerned whether that might be a flag for anything else on the pressure of the service, or whether that was just run-of-the-mill sickness, I have to say. Just checking on that one. Then picking up on what David was saying around the numbers outside of the area and located outside, is a large proportion of those, or majority of those, around the unaccompanied asylum seekers, or not? And is that, again, something you mentioned it's on pause, I think, at the moment? How long is that pause for, and what other pressures and mitigations are you going to put in place against that? And finally, just wondered what support the IROs are getting in terms of AI, because report writing, I know that from listening from some SEND sort of innovations that's going well there, whether you're having the same success.
Thank you for those questions. So absenteeism, it wasn't related to kind of work-related stress. It was just really unfortunate issues, personal issues to those individuals that couldn't be anticipated, but they had long periods of time off work. They weren't just a couple of days, they were months. And so that, that was really unfortunate for everybody, those individuals as children. So it's not around the pressures of the role. IROs have significant amounts of management access, so they can contact me whenever, and they have monthly one-to-one supervision where we do professional and personal development. So just to reassure you that I'm confident that those absenteeisms weren't work-related. In terms of children out of area, it's a real challenge because what Bath and North East Somerset Children's Services are really successful at is keeping children with their families. And that is hugely the best outcome. We all know that if a child is placed with family members, that is likely to be the best outcome for them. So family members can also live outside of Bath and North East Somerset. So what this report probably doesn't give enough breakdown of is, where those children are placed but they could be with family, which I would say is a better outcome than being with a foster carer in our area. Our unaccompanied young people, as I've said, have at times been placed before they've come to Bath and North East Somerset as corporate parent. We've also got children with complex needs who have come into care via our disabled children's team, so working with their families to identify the best place for them. Bath and North East Somerset don't have any residential settings within our area, so any children that require residential care or really skilled kind of complex care 24/7, they're going to be placed outside of Bath and North East Somerset. So I think, and what we know is that what's best for children is how their needs can be met. So if we look back at Sky, she was placed significantly far out of area, but actually her pressing need at the time of coming into care was for safety, and the foundation for any child is they have to feel safe in order for them to recover and to have really good outcomes, or for there to be changes in their circumstances. So an IRO would be much more concerned about what is this care arrangement providing to this child, rather than where is it sometimes, because actually if this child's needs are so comprehensive that we've got this excellent care arrangement but it's 50 miles down the road, or they can go somewhere with perhaps carers that aren't well suited or don't have the necessary skills. So I think we have to be really cautious as well about how much emphasis we put on where a child is placed, because it should be about what that care looks like, how that child has been supported to maintain connections and to foster and maintain relationships with family members.
Okay. And then I think Leslie might be my last person on this item.
Yes, thank you for the report, Sarah. It's very detailed and very, very welcome. On 6.10, I have concerns, I'm sure the panel does, that in Q4 there was this 29% overdue CIC reviews. So what is being done to improve that? On 7.15, this is about transition of children to adult services. So the very last point there talks about this being challenging, remains an area for improvement. So can we have some more detail on that and what is in place to improve that? On 10, the voice of the child. Again, this is improving, which is welcome, but what more can be done? And then thank you very much for including the equality impact assessment. I think you're the first person to have actually done this in the report, rather than just have a link to something somewhere else. So I'm just a bit concerned that really the final column ought to be saying where the negative or positive impacts are, and some of the points raised in the report are not in that third column. For example, this late reviews are not there, and how it affects people with different protected characteristics. On 3.4, gender reassignment, it talks about the IRO report doesn't consider issues, and I can understand that in terms of not identifying people, but how will their needs be met and promoted, as it says under 3.10 for people with a religion and belief? On disability 3.5, I'm just wondering if you're using the social model of disability rather than the medical model. And 3.8, sexual orientation again. How are you supporting LGB plus children? What mechanisms are in place, and how will you support their needs and promote them? And care leavers, this was something that was agreed to be included in the template, and it's been omitted. So will that be put in at a future date? Thank you.
Thanks for those questions and highlighting those areas of the quality impact assessment. I think in relation to the latter, it might be helpful if I provide more detail and subsequently to the meeting. So I'd be happy if perhaps Councillor Mansell wants to send me those details and then I can revisit the EIA. Certainly care leavers, as an example, wasn't intentionally to be excluded, so I can either apologise that I've got the wrong template because I thought that they were set out, so now I fear that I may have used the wrong one. So if you'd like to direct any of those points around the EIA to me, I can certainly address those. In relation to transition to adult social care, which is, I think, Councillor Mansell, what you're referring to from item 6.10, so that's certainly a challenge, and it's certainly something that adult social care and children's social care are actively talking around, how to improve that kind of transition planning. I'm actually just been asked very recently to undertake a piece of work as an independent person of the council to look at a particular transition for a child to adult, to look at any learning for all children, and that's not going to be a short piece of work. I think it's going to be quite lengthy, but that's to, whilst it's about a particular child, it's to look at all children so that we can think about practices and the differing legislation and the different narrative. Children under 18, adults still make their decisions, taking on board their wishes and feelings. When you're 18, you're an adult, and within your own right, issues of consent and your decision, what you want to happen for yourself. So there's some real tensions around, I think, the differing legislation and the different narrative around, and certainly I think colleagues in children's social care and adult social care will probably accept that there's the narrative sometimes and the use of language is really different. So hopefully that piece of work that I'm going to be taking forward will help us for future transition planning. Needs assessments and pathway plans are the kind of conduit for thinking about what a child needs beyond 18. And I think, as I've put in the report, we need to have greater scrutiny by the IROs when they're not completed. What does that actually mean? And to escalate those and to utilise the dispute resolution protocol. So my approach within supervision is, before supervision, I always look at all of the data for our children in care, and in a meeting with an IRO, I talk to them about these children who are 16 plus. Are they confident that plans are in place, or plans are starting to progress and assessments are informing those plans? And where they can't, then we talk about those and we agree kind of what next steps they need to take. I apologise, Councillor Mansell, you made a reference to the voice of the child, and I'll just have to remind myself of the paragraph that you made reference to.
So that was item 10, where it says it's improving, but I was just asking what more can be done.
So I think, as I just shared, it's about thinking about how, not just how we get feedback, but IRAs kind of obtaining the wishes and feelings. We have a really strong advocacy service in Bath and North East Somerset, provided by Off the Record, shout out. And we work really closely with them. They come to our team meetings regularly. We talk about what barriers there are. Not every child in care wants an advocate. The best thing to have is a really good relationship between the child, their social worker, their carer, all of those in the system around them that they can openly talk to, whether it's good things, bad things. So the IRO absolutely should be capturing the child's voice, and I would confidently say that when you review our child in care review records, you will see the voice of the child and their aspirations, what we've celebrated, and areas for them that perhaps we might need to improve or that we want to strengthen for them. And whilst it was a couple of years ago, when Children's Services Social Care were inspected by Ofsted in 2022, they commended the IRO service for the sensitivity in which they wrote their reports to children in care, and that standard hasn't changed. So I feel that as a service we are really strong at obtaining children's wishes and feelings and their voice and advocating, and that is the whole role of an IRO. They're independent of everybody, they're there for the child and to think about what's best for the child.
Thank you. And then picking up your point before, if Leslie wants to send those questions that haven't been answered through Mark, and then they can be forwarded to you, and then the response is circulated to the rest of the panel as well. Thank you. So the panel is asked to agree with recommendations, one of which is about noting the challenges and And then the second part is promote the role of the independent reviewing officer as well. Is the panel happy to note these recommendations? Sorry, to agree these recommendations, not maybe to note. Okay, I'm not seeing any dissenters. Thank you. Thank you very much, Sarah, for your willingness to be here and to answer all the questions as fully as you have done. Thank you. Okay, the next item is our Education, Health and Care Plan overview. Paul, do you have anything you wish to put to us before we move to Laura? And welcome, Laura. If you'd, when Laura comes to speak, if you'd like to introduce yourself properly as well, that would be great. Thank you. Paul.
Thank you, Chair. I'm pleased to introduce Laura, because I think you've been here before, haven't you, Laura? And there's been a series of perfectly reasonable questions that have been asked about SEND. And just in terms of context, in the South-West, there's a lead person that's been appointed by the DFE that's looking at across the South-West, because this is a major issue, and the SEND numbers have increased so much, and the performance in most of the other local authorities are really struggling as a result. And we're in the safety valve, we think, scheme, which the government brought in, the previous government brought in to actually try and deal with the pressures around SEND. And our application is currently on hold by the DFE, and the government's just announced that they're going to stop further authorities going into safety valves. So at the moment, that's all up in the air. But in simple terms, you will remember, Chair, when you were a Cabinet member, there was real issues for us in Baines around SEND, and Laura's come in and she's tackled a major challenge, I think, for us as an authority around SEND, and is making real progress. So I think the report that she's going to give today is a snapshot in time, but I think the service is improving enormously from a really quite a low level originally. So over to you, Laura.
Thank you, Paul. So I'm Laura Donnelly. I'm the Head of Service in Baines for Special Educational Needs. So I look after the statutory part of the service, which is the part of the service that looks after young people who have applications for education, health and care plans, who are being assessed for a plan and subsequently then are issued plans. So that's the part of the service that I look after, along with some early years funding as well. So I've sent in advance to you a report outlining some data to answer some questions we had around the status of the service at the moment. And so in order to save time, and assuming that you have had a chance to read that, I won't go through that in too much detail, other than to say numbers continue to rise for education, health and care plans nationally and in Baines as well. We have 4.9% of our young people in Baines who have a plan, against a national average of 4.8%, so we're very slightly above the national average for plans. We continue to have around about 500 applications for plans every year. I think we're in around about 470 so far this year. We'll have a few more before the end of the year, no doubt. And we have had quite a stable number of plans issued over the last few years. We're expecting to be at around 360 this year. That was the same in 2023 and the same in 2022. So the same sort of numbers are coming in, and the same sort of numbers of plans have been issued now for around 3 years. The major challenge for the service is to keep up with that increasing number, so that's those extra every year on top of the ones we had before, with challenges around sufficiency in particular, around our special schools, our resource spaces, and our resources within our mainstream schools. So one of the things I've been asked to report on is timeliness, and so that's how long it takes to get a plan, to go through that process. I've been working with our Parent Carer Forum quite closely around timeliness recently, and really listening to the voices of our parents around the importance around that. And you'll see from the data that I've provided, we've had some historical challenges around data quality that have made things look perhaps worse than they actually are in terms of timeliness. If we look at requests that have come in from September 2023, we'll see we're at around about 35% on time. If we look at requests that have come in this calendar year, we're at 39%. on time, which is an average of around about 24 weeks to issue instead of the 20 weeks which we're asked to do in law. Our parents and carers tell us that it's really the quality of the plan that's important and the quality of communication. And so there are things that we could do within the service to pull that number, to improve that number. So we could start doing things like issuing plans before we've had all the reports back and you can issue a plan and say, well, when that speech and language report comes back in, we'll add it into the plan afterwards. And then it looks like you've done it on time. It brings you within the 20 weeks. But actually our parents and carers are telling us they don't really want us to do that. They want a final high quality plan that's been quality assured, rather than multiple different issuances of the same plan just for the sake of a 20-week timescale. It's the same with naming a school. So if we're struggling to name a school, we can name a general type of school rather than naming a specific school. And that allows us to finish that plan earlier and perhaps come within the 20-week time frame. Again, we know from our parents and carers that there are occasions when they don't want us to do that. They want us to wait until we've had our information back from schools and wait to name the school that they agree is right for their child or young person. And so it's a much more complex picture than just a very straightforward 20-week deadline. If I could get all of our plans in 22 weeks, I think I would be very happy with that. And so we've got a way to go to get to that point, and at the moment it's actually, because that's a mean figure, there are some vastly higher than that, even up to 50 weeks, and there are some that are much quicker than that. So it's really those long, I'd rather that everybody got in 22, 23, 24 weeks than some people had to wait 50. So it's that inequality that we really need to start looking at within the service and ensure that everybody's getting a good level of support through that process. I was asked specifically to talk about sendist appeals, so when a family appeal to a tribunal. So we'll just speak to that. So the tribunal is the only recourse for the local authority and families when there's a disagreement between professionals around what's best to go into the plan, which school is correct for the child or young person, or what provision is listed for them. That's what's provided to us in the Code of Practice, and we never choose to go to tribunal lightly. It's always because we've been unable to resolve at mediation stage or further. So when you look at national statistics around tribunals, and it looks as if local authorities, and people use the word lose, I don't think that's a fair word to use here, that tribunals find in favour of parents very often. Quite often that's actually before you get to the tribunal point, because you're working to try to agree a resolution beforehand. So it will be listed as if the tribunal has found in favour of the parent, let's say, if you come to an agreement beforehand. And we work really hard to do that. So we would much rather make that agreement than go to tribunal and have a judgment that said, oh, it's for the local authority, for example, but you've then made things last a lot longer. Children, young people haven't had access to services potentially during that time. There's been a lot of uncertainty and stress for families. So in 2024, we've had 81 mediation requests come through so far, and 49% of those we've resolved prior to needing to go along that journey of tribunal. So half of them we've resolved before that point. We then continue to work all the way through that process. And on slide 13, if you've had a chance to look at it, you'll see what the outcomes are around that. So we went actually to full tribunal for very, very few cases. For the majority of them, we would agree with the family beforehand some kind of resolution. Now, for an example that comes up quite often for us is a family would like us to name an independent school, for example, but we feel we have a maintained school that can meet the needs of the young person. And so we work with that family to try to come to an agreement that works both for them and the child or young person, but also for the public purse around how much that placement will cost. And quite often that might be a resolution around something like transport. So the family says, if you pay the fees, we'll transport the young person to the setting. And when we work it out, because of the cost of transport, that's very cost neutral for us to do that in some cases, not in all. So we're pragmatic in that case and say, look, the cost is just about the same. If you can take the child there rather than us book a taxi, we will then pay the fees, because that works out the same cost as driving to the other side of Bath to go to a different school that the local authority might agree. In that case, we would agree prior to the tribunal, and we would then have an order issued to say that the local authority conceded in that case. Well, we did, but actually we worked with the family to try to resolve prior to getting to the tribunal, and we were trying to just be reasonable about that when we consider the needs of the child, the family and the public purse. So in those cases, it does appear as if the local authority, as if it's gone against us, I guess, but what I see those as is times when we've managed to mediate and work successfully with families to be able to come to a resolution without stretching out to the final tribunal actual meeting. In that case, we've had just a few that have gone to tribunal this year, one found in favour that have gone to full tribunal, one found in favour of the family, one found in favour of the local authority around naming schools, both of those. And then there was one which was around provision for a very specific type of provision that we could meet through other means in the local authority, and they found in favour of the local authority for that one as well. So I've put information about annual reviews, although I wasn't asked around them, because my parent carer forum tells me that's a really big issue for parents at the moment. When I came to you last, it was communication that was the biggest issue, and we've improved significantly there. There are still issues on occasion, but they are on occasion rather than as of course. We're now hearing from our parent carers about the next thing that's important to them, which is annual reviews, which is important to us as well to be able to issue those every year in line with the law. At the moment, around 53% this year of annual reviews were done this year. And so that's some way away from where we want to be, and we're working within the council to increase the workforce to be able to do that. The challenge for us is the number of cases that our case officers hold, and until we can bring that down, we really won't be able to improve some of these figures for you and for our families within the area. There just simply needs to be more bodies on the ground to process that paperwork and make those decisions. So I'll leave it to questions from you. Thank you.
Thank you very much, Laura. Joanna, and then Onka, and then Kevin.
Thank you, Laura. 3.2, the report states that we expect this increased expertise and support in schools will reduce the number of children and young people requiring an EHCP. Is this based on evidence? With an increase in the EHCP need assessment requests and an increase in issued plans, shouldn't we be prepared for a continued increase despite increased expertise and support in schools?
Thank you for your question. I think there's a lot of evidence that points to early intervention being very important for our children and young people. And so the purpose of the Send an AP advice service, which just started in September, is to work with schools to intervene at the earliest point for children and young people, to ensure that schools have the expertise required for the changing needs, that they can consider curriculum, school layout, environment, etc. And we would expect that that increased support in schools at that earlier stage would reduce the amount of support needed later on for that child or young person. And a good example of that might be where there are mental health challenges for the young person, that the earlier that support is put into place, the less likely it is to escalate to a point where significant intervention is needed. So the Send an AP advice service are focusing on that, supporting young people further on in their academic careers, of course, if that's difficult for them, but really trying to get in at the earliest possible point for them. And so I do believe we can be optimistic about that. However, the service hasn't planned to change its focus on increasing its staffing numbers, for example, to be able to manage that. We haven't changed our plans around looking for additional sufficiency within the area, so resource spaces, the new schools that we're opening. And so it's really to support that. And I do believe that we will see a reduction in the volume of high needs young people that we have within the local authority because of that.
3.4, the number of appeals lodged with Sendist has increased significantly for the past 3 years. The cost for legal proceedings are shown on the slide as per month cost, which we didn't think was very helpful. The Barthelmess Green Group in November put forward a question on legal costs, which we understand has been over £200,000 since 2019. What are we doing to decrease the number of appeals lodged? Many appeals are about needs assessments being refused, and these are usually won at tribunal stage. Wouldn't it lead to better outcomes for children if we would refuse fewer needs assessments requests?
So I agree that there is a proportion that are due to refuse needs assessment requests. I think that's a really challenging thing for us to consider when you think about the amount of time that goes into a needs assessment from the local authority, but also from our partners in the NHS and our service partners in the third sector, for example, our social workers as well. The more pressure we put onto those services to provide reports for needs assessments, the more difficult it is for them to do the other work that they need to do. So it has to be a balanced approach around that. And we need our schools to support us in ensuring that we have enough information available to us to make the right decisions about needs assessments the first time around. So what often happens is that we are awaiting certain documents or what we call the graduated response, but evidence of what the school has done to support the young person. They're awaiting that when it gets to panel, and if that's the case, panel won't be able to make an accurate decision unless we've got those reports in. And so quite often we end up going to mediation, and at the mediation point, more documents are provided by the school or by other people, and we're able to say, yes, we can now see that the 2 legal tests for the assessment are met. The decisions that we make within those panels follow the 2 legal tests and no others, which is it likely that the young person has needs, and is it likely that they need more support than the school can offer within their usual means? It's that second point that's the tricky one, because that's when we ask our schools to say, so what have you provided to show that they need more than you can provide? And that's the bit where the Centre and AP Advice Service also comes in supporting our schools around what information needs to be put forward to panel. Ideally, you would rarely say no to a needs assessment request, because your schools would be working with you in such a way that they would only submit when they had the right information and when it was necessary for them to submit. Obviously, it comes from other people as well, but generally speaking, particularly if it comes from a school, we want to be at a point where we say yes to 100% of those. And so the Centre and AP Advice Service are working with schools, and I would imagine that what we might see is a slight drop in applications over the next few years, but an increase on how many of them go through first time around.
Okay, but you don't seem to really be answering the question about the legal proceedings, because we clearly know that children and the young people involved in this and the wider families are clearly in a challenging situation during that time period. So can you give us a bit more information about how you support that group at that time, because they're basically just sort of left in the dark and feel very alone in that space?
I do understand that it's really very difficult for families during that time. I would say that they have their schools that are supporting the young people, so they aren't alone in that process. The schools should be doing everything that they can to support during that time through SEND support. And the majority of those cases are resolved at mediation stage. So, like I said, panel doesn't have enough information to say yes. We then book a mediation with the family and more information is taken and then it's resolved. I know that is a really difficult situation for our families, but that's the process that's provided for within the SEND Code of Practice. And so we follow the process that's provided to us. We are not able to say yes to needs assessments that don't meet those 2 legal tests. It wouldn't be right for us to do that. That's not what the Code of Practice asks us to do. It's clear enough to suggest what we need to do around that, which is that we need to get that information around what's being offered and that needs are greater than can be provided for at SEND support. So I would encourage families to work with schools during that period whilst we try to resolve any disagreement around that, and we do move them forward as quickly as we can.
I guess that then brings us back to the question that we had earlier about children taken out of school and being homeschooled, is that you then have a situation where an awful lot of young people, parents including, are frustrated by that process, take them out of school, homeschool them, and then you get into a different system. And there is a disconnect between the two, and it's how do we support the young person at that time not getting good education and their families being supported and us knowing about what's going on in the home so that that young person's life is better for it. And there seems to be a problem here.
So I would welcome coming back to talk about EHE, about elective home education, because I don't have those figures with me, to talk about how many young people we've taken that have made the decision to go to home education with their families, and that isn't looked after by my part of the service. So I would need to get that information for you to be able to comment on how many young people have gone to EHE in the past year, for example.
I think that would be a useful bit of information for us to have, and to then see how there's an overlap. I have one more question. I can see Chris has got his hand up. You have submitted a staffing request, and how many FTEs is this? Is this enough? And we've presently heard that the team members are currently responsible to 300 to 400 children each. And this seems to be quite a high number. Thank you.
Yeah, so it's between 250 and 300 for a full-time colleague, plus needs assessments on top of that, and that is very high compared to our neighbouring local authorities. So we have put in a staffing request that we've recently revised in order to attempt to get enough staff to bring that down to significantly lower in line with colleagues. It's very difficult to compare local authorities because Ken's sends caseworkers do slightly different things in different local authorities, so you can't necessarily compare the number of cases. We'd want to drop that number to around 150, 160 if at all possible. So we have put that request in, and we're working to increase the team so that we can provide a much better service to our families and young people.
I do hope that's going to be in our budget setting.
Thank you.
Thank you for those questions and your responses. Onkar.
Thank you, Chair. Thank you, Officer. So, in terms of mediation success, so what strategies are being implemented to increase the success rate of mediation and reduce the number of cases that proceed to tribunal?
So, whilst there's a responsibility for the local authority to provide mediation for families, there are cases when families do not take up that request, that offer of mediation, and decide to go to tribunal instead, which is absolutely their right to do so. They're issued a mediation certificate, but they don't actually attend the mediation meeting. And that's one of the things that we are working really hard to resolve, because if we can't get together and work with that family, we can't move things forward effectively for them. And so part of that comes down to our improved communication with the family beforehand. So why are they choosing not to go to mediation? The wait for a tribunal is about a year at the moment, whereas mediation is much quicker. It's usually around about 6 weeks, and so we can resolve really quickly if we get to mediation. So the first part of that was improving the communication from the team that we're still on a journey with, but it's much improved from where it was, so that we've got better relationships with our families and we need to try to help them to understand, although I appreciate it's very, very difficult, that this is not the local authority trying to be combative. We do want to work with them. The quicker we can resolve, the better for everybody. And, you know, if for the young person in particular, the family, but also you'll resolve at lower cost as well if you do it quickly. So we really do want to do that with families. But I think it is about that relationship beforehand, and an increase in staffing numbers will really help us to build those better relationships so that there's more trust between us and families and we can move forward quickly.
Thank you. And my last question is about just the timeliness of assessment. I know, like, sorry. So, yeah, I know, as you mentioned in the report, quite a lot goes to the staffing issues, but what measures are being taken to improve the timeliness of EHCP assessment to ensure they are completed within the statutory 20-week time frame?
So you're right, some of that comes down to the capacity of my team, but a plan is only of high quality if the advice that we receive is of high quality that goes into that. And so it also speaks to the pressures on other services, so the NHS, our therapies colleagues, the third sector, and social care. So if we don't get all those reports in on time, we can't write the plan on time. So our quality assurance officer is working really closely with our partners around the timeliness of their submission of their evidence towards the plan. And we have recently recruited a designated social care officer within the local authority to help. Part of their role is to help coordinate that with social care, because that social care advice is really so important, and our parents tell us and carers tell us how important that is to go into the plan. And we also work really closely with our designated clinical officers in the NHS to ensure that we have our health advice as soon as possible. But there is a delay, particularly for occupational therapy advice. And then, as I was saying earlier, if a family want to wait for that advice to come in, then we do wait for that rather than finalise the plan without it. So there's that work with our colleagues in other service areas that we do. And then there's the actual physical writing of the plan. And so staffing is one of the things around that. The other thing that we're looking at is how we use technology to support us in that role. And there are different products coming onto the market that will help us to reduce the amount of time that it takes to write the plan itself, because it can take up to a day just to draft the plan, and anything that can make that easier for us whilst maintaining a really high quality plan, we're looking into doing, and we've got a project running alongside with that as well. Okay, thank you.
Okay, so I have Kevin, Paul, and then Liz and Leslie after that. Okay, so Kevin next.
Thank you, Chair. Thank you. Laura, just a couple outstanding now, after the several questions before. First one, around you were saying the most common type of need for EHCPs around autism and speech and language communications. Just wondered if how things are progressing in terms of maybe trying to head these off at the pass on around early intervention, and whether there are resources they're able to do that. The other couple of questions is one around, is the Send an AP advice service involved with all schools before they submit any needs assessment, and is that sort of a negotiated agreement now? Has that sort of come to that? And finally, around annual reviews, who is actually responsible? Is it the school responsible to carry it out, or is the ELA to make sure that the school does it?
Thank you, Kevin. So the annual review one I'll do first because it's the easiest one to answer. So the local authority delegates the responsibility to the school to hold the review. However, there have been a number of ombudsman's decisions, not against our local authority, that have said that the local authority still does need to chase those reviews. Now, the majority of the reviews get done. The actual meeting is done. It's the processing of the paperwork afterwards that's the problem. And so we believe, but it's hard for us to measure at the moment, that the vast majority of plans go ahead, as in there's a quality conversation between all professionals and the parents. The local authority don't need to attend that unless there's a change of placement or something similar being asked, because my officers don't know that child or young person. It's not appropriate for them to be there. And so that goes on in our absence. They send the paperwork in, we process it, and it's that bit that gets caught up, the actual processing and reissuing of the plan and the writing of the letter. And so we know that Ombudsman would say that we're responsible for the whole thing, and we need to check in on it. As soon as we have a better technology solution around that, so having a portal is something that we've been talking about for some time. I probably spoke about it last time I was here, but so that parents, schools and the local authority can better monitor what's happening with that paperwork, the better really in terms of reducing workload and making sure that more things get done. Send an AP advice service. So they're working at the moment with I think they said 63% of primary schools they've had contact with so far this year, and they just opened in September. And I believe they've been to all of our maintained secondary schools. And so they are working really hard to not only step in when a needs assessment is turned down, but to step in at a much earlier stage. And so through our SENCO conferences, and also through the hub, we'll be communicating with schools around this being a fantastic resource. They are really experienced practitioners on that line as well. And they've been going out to schools, meeting with SENCOs and working to support our schools to intervene earlier, which sort of feeds into your other question around early intervention for autism and speech and language, and I would say social and emotional mental health as well. The Send an AP advice service have an instrumental role in that, but so do our partners in our commission services, such as SAS, being able to come out and support schools where they have a young person who's struggling who has autism, or speech and language support as well. So I think there's multiple moving parts that sort of all come together around the Send an AP advice service really being the hub of all of those things. And the practitioners there, we are incredibly fortunate to have the quality of practitioner that we've managed to recruit into those roles, and they have started really, really well. But it remains to be seen what happens next.
Thank you. Next on my list I have Paul and then Liz.
Thank you very much, Chair. So first of all, can I start by saying we've had an incredible set of presentations from case officers today on all the subjects. They've been really knowledgeable, very full, very forthright, and I think we need to record our thanks to the officers concerned. The points I was going to make have actually been raised by Joe, but I wondered if I could add a further recommendation. I don't need to repeat repeat the points that Joe raised and get the same answers to questions back because they were very full. But I wonder if we could add a new recommendation, 2.3, along the lines of call on Cabinet member to argue the case in the budget process to support the request for staffing increases to reduce the caseload to approaching 150 cases per staff. I think sometimes it's not a question that this panel just notes things. I think sometimes we should reflect back on that noting and challenge Cabinet to come back. And so I'd like to move that motion if everyone agrees with the wording and see if anyone wants to second it. Right. So can we have a vote on that at the end when you come to the vote on that motion?
Okay, and if anybody wishes to speak on that point, you can, but obviously try and do it succinctly, please. Thank you. Paul, did you want to say anything else? Or
No.
In that case, you may
I
turn your
got
microphone
questions
on.
answered that I was going to answer. Thank you.
Liz, and then Leslie.
Thank you, Chair. A lot of the questions I was going to ask have been raised, but there are one or two I'd like to add, and I think I'm not speaking on our motion we just passed, but I think you do have to have more people working. You're saying the caseload is far too high, and it's not just people within your team, but it's obviously people connected, social workers, etc. So it may be a holistic view to look at this. I have contacted you, as you know, when residents of Bolton have really been tearing their hair out because it's gone past the 20 weeks. Their children refuse now to go to school, so they've been at mainstream school. For whatever reason, they cannot cope. They will not attend. They refuse to go to school. They're not getting their educational healthcare plan because there's time limits involved. What happens to these children? They become school refusers, I believe, so therefore some of them will stay at home and not go to school. Is there any help available for these youngsters to stop them becoming school refusers? They haven't got a healthcare plan, but is there some sort of help that they can get?
Yeah, so the responsibility for providing education for those young people still sits with the school, even if they're not able to come into school. So for the first part, we would want the school to be working with the families and young people to try to repair that relationship, to try to really get underneath what has meant that the young person feels that they can no longer come into school. And so the school would be working with them, going out to the home perhaps, supporting the young person to come back in, putting in reasonable adjustments, and you would hope to build up from very gradual starts to build relationships for that young person to re-attend the school again. That's that's sort of the end result if that has happened. However, as I think you were saying, it's much more important to come in much earlier on from a school point of view to avoid emotionally based school avoidance. And so schools track the attendance for each of the young people, and they should be looking out for those early warning signs. We have a toolkit available that we've borrowed from another local authority at the moment, but that we're working to bring out our own toolkit, or the educational psychology service are, so that schools are very clear on how to work with families and with young people to help them remain connected to the school, because it's about belonging and being part of that environment. That's what draws that young person in, even if things are tough. And so an EHCP wouldn't necessarily stop a young person from that journey of not attending school, emotionally based school avoidance, if the school are unable to hook them in. It's not sort of a magic wand around that. What it can provide is a bit more funding to allow the school to do that more effectively in some cases. But it is that relationship and that belonging that's most important, I would say.
Yeah, and thank you for answering that, because I was about to say, has the school got capacity for this? And you're saying there is funding. Is this from Safety Valve? Would this money be from Safety Valve to help the schools cope with this extra thing they have to do?
Yes, sorry if I was misunderstood there. If they had an EHCP, there would be funding attached to the EHCP. They would need to spend out of their national high needs budget, which is very stretched within schools, and we know that's a national issue for them to be able to do that. And they can work with our hospital education service if the young person has medical reasons why they're unable to attend. But things have really got to quite a serious degree by the time hospital education would be involved. You know, you've been to your GP at that point, or even to a specialist, because things are really difficult. It's for the school to step in before that. But no, we don't at the moment provide funding out of the high needs block to them, any additional funding to support that.
Last question, if I might. You have mentioned the portal, and that looks like a very positive thing, where 24/7 parents can access their case notes and check the progress of their case, so that must be really helpful. Is it up and running?
No, and unfortunately it's still in the early discussions stages, not the development stage yet. And so we've had a number of hurdles that we've needed to get past as a service in order to move forward with the portal. But we're really committed to doing that, and we are continuing to work with our colleagues in the wider council team to be able to move that forward. But at the moment, I think it'll be at least another year, I'm afraid.
Thank you very much, Liz. And Leslie. Sorry, I confused myself because I ticked you off already, Leslie, but you've not spoken.
Thank you for the report, Laura. It's a really important one that we need to look at in great detail. Quite a number of the points I wanted to raise have been picked up, so I'm going to just look at some of the outcomes. So one of the outcomes in 3.3 is that parent carers are saying that the quality of the reports are much better than meeting the 20-week deadline. So I would have thought that that was quite an important thing to put in the equality impact assessment to show that that's a positive impact. However, there's still the issue of all those that are not meeting that 20-week deadline, so that would be a negative impact. And similarly, a bit further down, been processing a backlog, which is a negative, but then there's a positive that you've improved by 35% since September 2023 in timeliness. So again, that could go into equality impact assessment. So looking at the equality impact assessment, page 3 of 10, under 2.2, it says primary need, and there are a number of letters there, and I don't know what they mean. Could you put a key in on that? So it says ASD, HIMLD. I don't know what it means. Thank you. And then also the rest of it, most of the final columns just saying there's not anticipated to be an adverse or negative impact, but how do you know that? Because you haven't put the evidence down as to why that would be one way or the other. However, there's clearly plenty of issues around the negative impact potentially or positive impact, and there's no action plan that I can see at the end of it. So it'd be really good to have that a bit clearer. So the only one that doesn't say there's not anticipated to be any adverse or negative impacts doesn't say that after disability. So does that mean there will be some negative or positive impacts? And if so, what are they going to be? Thank you.
Thank you for your feedback regarding the equalities assessment. So I do appreciate what you're saying there around there being more detail. I think in order to include all of that into that qualities impact assessment, it would be very lengthy indeed. I think the safety valve plan that we have outlines all of our plans moving forward for how we will improve the service, and ultimately improve the outcomes for our children and young people. And so I wonder if moving forward, perhaps referencing that plan would be helpful for you, so that you could, rather than writing it all out again, so that you would have a better understanding of where we are as a service in terms of our improvement plans, because I do believe that's well covered within that document that's come to scrutiny before.
Sorry, Leslie, I wasn't sure if you're going to come back on that.
If I may, I mean, it's fine to put those plans in there. I wouldn't expect you to put everything in there. The equality impact assessment is a tool to show us what's going well and what isn't going well. And it would be good to have some evidence of that in there, rather than using this as a tick box exercise or just skimming over the top. So, yes, certainly link it to the plans for more detail. But this is what we have the EIA for, so we know what that is. And this doesn't really tell me that. Thank you.
Okay, thank you for your feedback.
Okay, Laura, did you want to add anything else?
Just feedback noted from me, thank you.
Thank you. Right, Joe, I've allowed you to come back very quickly.
I have 2 points. One, on the number of children that are being now assessed. The numbers have gone up through the roof, and nobody seems to have any idea about why this is happening or where this comes from. And I guess that's a wider question that we need to consider. In terms of autism, I believe it takes a diagnosis has to go through the NHS, so thinking about Laura Ambler and the work that she does with us, and that can take at least 2 years. So there's a whole autistic issue in this piece of work as well, which we don't have information on. And then my wild idea, Paul Crosley and I both sit on the pension committee, and you can imagine how much fun that is. One of the things in terms of paying the pensions is that there have been a lot, and they readily admit to their overview and summary of their performance has been problematic. And they have a proper system and KPI of identifying what that is, where their red areas are, how they're going to make sure that they don't fail further on various things. Fail is probably the wrong word that I should use there. But you can see that but over the last few years, it's been really interesting to see how they have worked. And I'm just wondering if there needs to be some conversation between this group of people and the pension group of people behind the scenes about how they administer what they do as a way of looking to how you can improve your, yes, it is performance, because you can see that there isn't enough going on, and why that is happening, and where that's happened for. So I just think that you have some expertise already in the council through the Avon Pension Fund that you could get advice from. And that just comes, again, about not being siloed. Other people are doing stuff like you, but in a different language for different reasons. Why don't you go and have a chat with them? Okay, that's okay. Thank you.
Thank you. To speak to the question around autism or neurodiversity pathways, so we know that there's a lot of work going on around that at the moment, but the EHCP needs assessment is a needs-based assessment route, and so whilst we still have some services where you do require a diagnosis to access them, the plan itself and the EHC needs assessment should not be held up by not having an autism diagnosis. It should be based purely on the needs of the young person and how they're presenting at that time. And so it's very important as part of this process to try to focus on that social model rather than the medical model of disability in order to ensure that every child gets the support they need for school, regardless of any diagnoses that may or may not have happened for them. We also know that at the moment, around about 33% of young people going through the pathway for an autism assessment don't receive an autism assessment at the end of it. And what we really don't want to do is have lost years where we're sort of thinking it's going to be an autism diagnosis and clinging on to that, when actually, I'm not saying that young person doesn't have needs, but those needs are actually different and come from different sources. And so it's very important to keep an open mind during that process as well, and make sure that we're just meeting the needs as they present to us. Thank you.
Chris.
I was just coming on the point around the pensions point. I think what you're looking for is a bit more detail behind what you understand by lateness. And just to give you some reassurance, we do have a dashboard which we do use, which tells us that we've got patterns in certain practitioners in terms of how they responded on time. We record if advice is late. We will record if there's delays getting a plan. So we do have information we can pull together to put together a much more accurate picture around what are the reasons for lateness. But always willing to learn from colleagues. I just want to make just a couple of other points and just really thank Laura for what has been 16 months. No, 15 months of really hard work in just really persevering with trying to get to grips with supporting the team while at the same time bringing new people in. We've been through a full business change process, so we've had a business change team in looking at all the processes start to finish, looking at the IT we use, helping us with that, and we do just have to come to the bottom bit of it now, where we just think actually we just do need more hands. So thank you for your support with the motion there around that. It's going to be gratefully received. And just a couple of things I wrote down as well, if you're asking questions about support for parents. Just to remind the panel that we do have the SENDIAS service in Baines, which is a service we provide to provide advice and support to any parent, whether we can contact them as well, so that you never need to feel like they're alone in their challenge, because it can be a real challenge. We're just about to start a pilot as well with our Baines Parent Carer Forum, a small pilot for a year where they're going to be providing not advice, because the legal advice stuff comes from SENDIAS, but this is more about the emotional support, helping parents do that as well. So that will be up and running as well soon. And we do commission a lot of additional services for those children who don't necessarily have any HCP but are out of school. Student Family Support Service, we have a range of services that parents can access outside of that as well. So just wanted to remind.
Okay, so Chris, can I just quickly check something with you? When you're saying thank you for the support, are you suggesting then that the additional staff that Laura is asking for is not included in the 179,000 already being consulted on within the budget? So this would be in addition to that?
We are looking to make a separate request as well, so we can support additional temporary staff to help us with some of the backlog.
Right, so in that case then that I think clarifies that. In which case then, can I ask the panel and can I ask the director to turn his microphone off? Can I ask the panel to vote on the recommendations as listed, plus the new recommendation 2.3, which it is asking for the Cabinet member to lobby for that additional funding through the budget process. So is everybody in favour of those three recommendations? Yeah? Thank you. We are still just about quorum. Thank you very much. But I will now rapidly move us on to the statement that we have been waiting for all morning from Councillor Jackson. So now is your moment, Eleanor.
Is that working? Right, because I have this habit of looking at pieces of mechanical IT things and they immediately blow up, and that's part of the problem today, that my computer died and then my printer died. And so you don't have the figures that you should have, and then my eyes packed up, so you don't have the figures with this statement that you should have, only an earlier version, but Mr. Burnett has kindly been through all the figures, and I hope I can get a revised set to you in time for the minutes, because it relates to the fact that £8,421 precisely are needed to carry through the revision of the new RE syllabus. We have had debates in the past about the Sacred Constitution, its relationship to the Council as a statutory body required by law since 1988, so that religious education provision can be supported, and the general issues for our residents. In 2021, at the same stage in negotiations for funding for the revision of the syllabus, I said, the values, beliefs and visions which should undergird our conduct as councillors and in our personal lives have to be learnt and communicated, and the new RE syllabus is crucial for helping children to do this. It may surprise you to learn that the present syllabus, called Awareness, Mystery and Value, is highly rated and adopted by other authorities, and that a number of our schools have won WIRE awards. These are national awards which I drew to your attention at your last meeting. Only 2 weeks ago, I took a WIRE Certificate of Excellence to the Fossway School because of the outstanding way that the children, who are all SEND and all have education plans, visited places of worship, such as the Basque Mosque. And I can't tell you how delighted the children were to have their work recognised, indeed to have a visit from the chair of Westfield Parish Council with his full chain on, telling them how much credit they had brought to the area. But excellence does not happen by accident. Not only is a good up-to-date syllabus needed with plenty of scope for adventure and creativity, but teachers need support and training, as Sacre hopes to provide, as it did last time round, with provision for training and understanding and recognition of Holocaust Memorial. And in this process of revising, I see you nearly missed out a whole page. We need to have this agreed syllabus. I'll send the website details of what's going on in RE. And given the current national RE landscape, which I mapped for myself when I attended a national conference in York in May, we will need to rethink and update our current agreed syllabus. This will be very different from when the agreed syllabus was reviewed previously and was adopted by the Council in September 2022. The new approach nationally might be crudely described as grassroots up. It focuses on ordinary believers' philosophy, meditation practices and worship, instead of studying a sort of heaven-down approach where revelation appears out of the clouds, scriptures, charismatic leaders and worship, which were the focus of the earlier syllabuses. The strength of the legislation, which goes back to the 1944 Education Act, is the requirement that what is taught reflects local communities. So when I was working in Derby I found we had the largest Sikh community in Western Europe. We had Sikh and non-Sikh children studying together in depth the beliefs which are scarcely taught elsewhere because there aren't that many Sikhs. I myself was training Muslim students very successfully to be RE state secondary schools teachers. With the recent tensions, which have been fueled to some extent by false identification of adherents of religions, an up-to-date syllabus and good RE is needed more than ever. To achieve this change, we need to consult widely in the profession and the faith communities, and this takes time and money. And we need to start this process now. We need to plan very carefully, and we shall be drawing in funding, we hope, in different tranches over several years, because it takes some time. We are all aware, however, of the position of the Council and its financial pressures. We've been hearing about some of them this morning. And I would not presume to say that RE provides the reasons why the authority should have compassionate and practical policies, but ethical values are surely vital to all that we do and understanding them. So the Baines Sacre will therefore seek to do with what funding is available from, the Baines Sacre will therefore do what it can to seek funding from other organisations such as educational trusts and to achieve economies of scale by working together with other sacres. And I've given a timetable which, as I said, can go in the minutes of what we hope to achieve and to do, and with a view of having it all completed by December 2025. And then we'll be drawing up appropriate materials and writing out new recommendations. And as I said, I also can put in the minutes the breakdown of the funding. I sort of had all this reinforced in my mind because in this report on equality impact assessment, there is mention of discrimination on the bounds of religion. I started on page 65, you see, and thought this was an independent report. I didn't realise it related to IROs. Anyway, I do think that it needs to be recognised by this council how even policies with regard to looked after children or the environment need to be, correlated with religious or non-religious beliefs. And I thought of an example that's perhaps a bit outside the educational field, but perhaps it isn't. If this council, heaven forbid, were suddenly to adopt an anti-environment policy, such as that fracking should be permitted everywhere in the Greenbelt, I would expect there to be an uproar from the Abrahamic faiths and from Buddhists and from other adherents. So it's really important in assessing any sort of equal opportunities, or whether any council policy, whether it relates to children or not, correlates with these values and will not be felt to be pejorative to one particular community or another. But anyway, what I would like you to do, please, panel, after your patience in waiting for this gem, after all, at the wedding of Cana of Galilee, they saved the best wine till last, I would request this panel to recommend to Cabinet for the SACRE funding for constructing a new agreed syllabus and related training be accepted. So I would like you to recommend to Cabinet that the appeal for funding be accepted.
Thank you very much, Eleanor. I will ask officers a question in a moment, but I just want to clarify. So you spoke of £8,421. Then you spoke about that you were putting requests into various other bodies and working with other SACREs. Is this then over and above, this £8,421, is that over and above the amount that you are expecting through those bodies?
Well, I believe so. Unfortunately, the officer is not here, who I was expecting would be here to answer a question like that. But I think Kevin's got the answer. And the other thing is, I think this is year one, the 8,000, isn't it? Yeah. So we're asking for £8,421 for the next working year. But of course, it's going to take time. And what we structure into it in the way of resource materials will be very much governed by what can be afforded from other sources.
Kevin.
I don't know about the financial bit, or guru bit, actually. Just to clarify, Chair, our SACRE advisor for Baines has, if you like, worked on the assumption that the new agreed syllabus has to be in place by September 2027. So we are working, or starting to work, or she is, this coming financial year 25-26 with teachers and people on the ground to try and start the process of gathering views and how that's going to work the syllabus in practice, and hopefully get on board as many of the MAT leads and RE and so on as possible. So because we're trying to acknowledge, well, we do acknowledge, not try, we acknowledge the fact that every money is tight everywhere, we are trying to think about applying for a West Hill grant to do some of the supportive work, and the main bit will be working with as many other SACREs in a sort of a regional hub. So we have got 3 or 4 on board already, but that might also extend nationally, because I know we've often worked in the past with Haringey and things in London, but certainly at a regional way, and we're working with the diocese as well to try and reduce the total cost is going to be. So the advisor has just submitted the 8,100 whatever pounds for the ground and key legwork this particular year to make sure we get it off the ground in time and in preparation for.
Okay, so can I then just ask our officers if they can... is this going to come into the budget proposals for 25-26? And if so, are you aware of this? And have you built this into your calculations already?
No, it's not coming into the budget proposals for 24-25 because it's funded out of the central services budget of the dedicated schools grant. So the request for the funding can come to me, and I believe that I can look at that as a decision, and obviously Olin sits in my team, so I'm quite prepared to look at that as a budget uplift.
Talking about 25, 26.
Yes, we are. 25, 26, yes.
It's all right. Chris was obviously just going back in time.
I'm just going back in time. For the 25, 26, it's dedicated schools grant out which funds the...
Okay, so I guess what we're getting to from this is we don't need to recommend anything. Chris is going to look at it. Is that right?
I guess you're recommending that I look at it.
Does everybody agree that we should recommend that Chris looks at it?
Can I speak?
If you want.
I don't think it's appropriate to do policy this way. I think we've got a meeting in January, and I think what we could do is ask officers to bring us a report on it to January so that it can be considered. We've got 3 of our committee not here at the moment.
It's something that's separate to the budget. That's what Chris is saying. It comes from the dedicated schools grants. It's money that comes in directly from government, and then it's dealt with in a separate manner.
Yeah, but you're still asking us to come to a view on it when we've not had really time to debate it.
We haven't had any papers to consider, so that's why I was saying that I think Chris should take this away, and then if required, bring us a recommendation. So I'm sort of saying, yes, I agree with you, right, but in a different way. Ruth?
Thank you. It doesn't seem very long ago that we were having a similar conversation about money to help with the previous version of the syllabus. So I was just wondering, perhaps has the system changed since then? Because we were definitely asked to give a view on that, weren't we? When was that? It must have been like two years ago.
Yes, it was a slightly different scenario, which I don't just particularly want to go into right at this moment because we are quite late.
Yeah, I know. One more question though. So if this year you're asking for 8,421, have you got any idea what you'll be asking for in year 2, or year 3, or will that be at year 1 and year 2?
I don't think, Ruth, we actually know the sort of what other local authorities will be doing yet at this stage. But because of the shortness of trying to make sure we get at least the decision considered, we had to put it in now because the first financial year with the legwork with the teachers would have to happen, if you know what I mean. So we're hoping that any future requests would be much reduced because the other SACRAs would buy in.
Can I just say one more thing, that from what I understand, government's going to give us a 3-year settlement, which we'll learn about next in the next budget, so not this forthcoming one. So you might want, as a body, to consider, your total sums for that period of time, rather than doing this slightly more ad hoc. We think we might want this much now, and then we might want some more later approach.
I think it was a case really that we wanted, we could have put a figure on it, but it was a bit too quick for the advisor to sort of try and get a whole scope of 3 years, but she felt that because of the uncertainty and not wanting to say we want £30,000 because everybody with gold would say there's no way, but if we could try and actually be as accurate as we could for the first year and hopefully may even not have to have as much at all for the next 2 once we've got those talks underway this year, if that makes sense. It was just the shortness in terms of getting ready for the new financial year. So definitely take your point. And I think she's got something in the back of her mind, but hopefully those SACRA buy-ins will reduce that significantly.
Okay, that's fantastic. So I'm not going to take any more comments on this. I'm going to leave this to Chris, and then to Chris to come back with this, whether it's appropriate for us to discuss it with the overall budget or separately. Okay? Right. Thank you very much, Eleanor, for bringing this to our attention. And I just want to very quickly move on to the work plan. So we have a number of items already within our work plan. We've asked for several extra items, such as the having our Director of Public Health, come to us to talk alongside Laura around COVID. I note that we already have long COVID on our agenda plan as well, and the vaccination programme, as well as social media. We will find a space for Andy Waite to come and speak about school streets and the, sorry, this is not Andy, obviously, music services, I know, has also been asked for a report on that, how well the charity is working across the three local authorities, home education, and obviously the budget as well. So these are all items that will need to be put in, as well as I think we will be doing this piece of work on early help, unless anybody has any fundamental reasons for not supporting that. I mean, it's a long-term piece of work. It's going to be at least a year, I would say, because we also need to factor in what is happening at government. And we hear, various different changes in legislation, but we need to be on the front foot in order to be finally getting to a point when we'll be able to lessen the impact of adverse childhood experiences, as well as reducing the amounts that we have to spend in the long term as well. So,
music service?
I did say music services. So is there anything else that's missing that was not covered? In that case, sorry. I've said that within school streets, so, and air quality as well. Sorry, with Becky coming. Okay.
I don't know if that could all be done at the same time, but a bit more information about the RUH's sustainable travel plan. But maybe that will come in a report from Laura and maybe.
Yeah, it might be worth talking to her directly as well about what it is that you specifically want to. On that, because obviously as a ward councillor...
I'll see what I can find out from the website first of all, but I expect...
Okay, but yes, the point is, it's noted. Chris?
An update on the building plan for the RUH.
Well, maybe we should have an overall RUH update then. I know they usually come and speak at the Health and Wellbeing board, don't they, with their proposals. So maybe we could have a report which will be predominantly for noting, for our information, because there's not much I don't think we will be able to contribute in terms of adding any value, but it would be useful for us to know about. So maybe we could ask Laura to add that to her next report. Yeah? Okay, in that case then, thank you everybody for attending, particularly everyone who's attended from the very beginning to the very end. Your contributions and your perseverance has been very much appreciated. And as this is our last meeting before Christmas, I'd like to take the opportunity to wish you all a very Merry Christmas and see you all in the new year. Thank you.